Independent Research in the Society, and World Unani Foundation also. Today, this webinar, 315th webinar, is possible due to guidance of Dr. Mohsin Dehlvi ji. Younis Munshi ji is our regular associate and guide. Munshi ji is guiding force in Unani fraternity. Today, I welcome Athar Amina ji from Germany, Professor Dr. V.K. Agnihotri ji from Uttarakhand, Haridwar.
Namaskar.
Welcome, sir, welcome. And our guide, philosopher and mentor, Professor Madan Thangavelu, sir.
Namaskar.
Welcome. Swagatam.
Namaskar.
As I told that like our in Ayurveda, we are celebrating this month as Unani month. I am regularly observing Younis ji and Mohsin ji is regularly conducting webinars on Unani Day. On next 27th, one webinar is also there on World Unani Day. So I really congratulate the team and its leader, Dr. Mohsin Dehlvi ji, and the team leader of RRI Unani Calcutta, Dr. Younis Munshi ji. Welcome, welcome, and thank you, sir. I hope Dr. Khalid will be joining soon. At present, I am unable to see his name. So I would like to start with Mohsin, sir, to elaborate the highlights of World Unani Day today.
Thank you, Pawan ji and Madan ji. Good evening to all. Assalamu alaikum. And
Walaikum salam.
We celebrate Unani Day on the 11th of Feb. But I think the February is the whole month where we do all the different celebrations, because one day it's very difficult for everybody to organize on the same day. So usually the whole month we call it a Unani month. On the 27th, we are going to celebrate it in Kerala. It'll be a hybrid. So I would request all of you to join us. I'll share the link with you. And we're expecting the Honorable Minister of State of Ayush in the seminar. And Khalid ji is also going there as an expert. We'll be having the our advisor Unani also. I welcome, I can see Muhammad Arif Saab. He's a owner of a very big Unani manufacturing company in Delhi. And he is the patron of Unani Drugs Manufacturers Association.
Shukriya.
I welcome you. Basically, like I said, it's celebrated on the 11th of Feb. It marks the birth anniversary of Hakim Ajmal Khan. The day highlights the contribution of Hakim Ajmal Khan in the development of Unani medicine in India. Unani Day is a tribute to him and also spreads awareness among people about healthcare delivery through Unani medicines. He was born on the 11th of Feb in 1868. And he was a Unani physician and educationist and the founder of scientific research in Unani system of medicine. He's developed, I think our speakers are going to stress on what research he's done. He's done it on Raufilia serpentina, which we call Sarpagandha in Ayurveda and Asrol in Unani. It's still being used in most of our medicines for, I think, depression, for high BP. It's very effective in that. Though the allopathic industry does not believe in this, But I myself use that because I'm also a patient of high BP, and I use my own medicine and I'm fine. Hakim Ajmal Khan took great interest in the expansion and development of the native system of Unani medicine, and to that end built three important institutions: the Central College in Delhi, the Hindustani Davakhana, and the Ayurvedic and Unani Tibbiya College in Karol Bagh. As Madanji was saying that he was not aware, this is a premium institute, and basically he wanted to show the integration of Ayurveda and the Unani system. And he gave preference, and that is why he put Ayurveda in front of Unani. So he did not say that Unani and Ayurveda, but Ayurveda and Unani. So he wanted to integrate both the systems, and that institute is still there. And I think it's one of the best institutes in India. Unfortunately, the Hindustani Davakhana is in a bad state. The government did give finance for upgradation, but unfortunately, it could not survive. A polyclinic has been opened in Old Delhi, and it's in Balimaran, but it's in a bad state of affairs. Very sorry to say that. His tireless efforts in this field instilled a new force and life into an otherwise collapsing medical system of Unani under the British rule. Both the systems, the Ayurveda and the Unani, were suppressed by the Britishers. They didn't want this system to survive in India. But he fought with the Britishers and kept these systems alive. On 22nd November 1920, Hakim Ajmal Khan was elected the first Chancellor of the Jamia Millia Islamia University. Since he was one of its founders, he held the position till 1927 until his death. During this period, he oversaw the university's move to Delhi from Aligarh. Basically, this was in Aligarh. Then this university shifted, and it's one of the top-end universities in Delhi. Hakim Ajmal Khan was a versatile genius, and along with being an eminent physician and social reformer, the man was a spiritual healer, a herbalist, and a distinguished Unani clinician. It is said that in Delhi, he did not charge a single paisa from his patients. But when he was called to go out of Delhi by rich people, or you would say princes of those states or something like that, he used to charge rupees 1,000 per day. And 1,000 in 1920s or 30s, you can imagine what price must be now at this time. Hakim Ajmal Khan had a career in politics too. He became the founding member and president of the All India Muslim League. He also served as the president of Indian Congress. And I think he presided one of the Hindu Mahasabha. Also, he was one of the presidents of Hindu Mahasabha those times. Hakim Ajmal Khan contributed tremendously in the development of Unani system of medicine. To recognize this, the Ministry of Ayush, Government of India, declared his birthday as the Unani Day. That's the basic history of why we celebrate this. The first Unani Day was celebrated in 2017 by Central Council for Research in Unani Medicine in Hyderabad. Fortunately, I was part of that Unani Day celebration in Hyderabad. I would now leave it to the other speakers to speak on him, because I'm not an expert on his life, but I think Dr. Ghazala Mulla is going to speak on his contribution. Thank you very much. Thank you very much, all of you.
Mohsin ji, thank you very much for this wonderful introduction.
Great.
Given us an idea of this big man who was universal mind. I think he connected with all the spirit of good health and well-being, and his achievements remain with us. But as you say, we need to do more. I hope over the next few presentations, we will have a a very frank and open discussion, like you have said about the Davakhana, the traditional thing in Old Delhi. I hope we can open up this discussion very frankly. Yesterday we were talking about Sanskrit and we had the same thing, a very open, frank discussion where many of those difficulties are aired. And I want to add here one point, which is that the World Health Organization in Geneva has an interest in Unani systems. They have a benchmark manual about Unani systems. And I hope India will give the impetus to refine this, like what was done with Ayurveda. Now there are 2 manuals available in Geneva. So that is one request from here when we look at the future of Unani systems. The second thing is how to achieve the dream that Ajmal Khan-ji had in his mind of bringing not only Ayurveda and Unani system, but also modern medicine together. And what can we do in Karol Bagh? You mentioned Karol Bagh Tibia College is one of the best institutions in India. I think it is a premier institution in the world. Younis ji is already connecting with people in Iran, the traditional Iranian medicine systems. There is so many dialogues that can happen. And I wish today we can think a little more about that and present very frankly what is needed. If funding is the problem, then we talk about, limitations of patronage. We see 3 big schools correct me if I'm wrong here. I see 3 schools here of Unani. There is a Delhi school, which may be connected with the Aligarh school, and there is the Lucknow school. And what else remains in the old subcontinent of India? I don't know what is there today in places like Karachi and Rawalpindi and all those places. I don't know what is there. Maybe Younis ji can tell us a little bit about this. And the reason why I point this is because there is an ongoing dialogue in the World Health Organization about these traditional systems of medicine. The current agenda comes to an end in 2023, next year. And I hope India is prepared itself to be a lead player in where the traditional complementary medicine agenda for the WHO goes for the next few years. And Unani is very, very important in this. And old institutions like Tibia College are very important. So those are things I wish that as we improvise and going through this discussion, all those sentiments will come out so that we can revisit this recording, it will be archived, and then we can rethink, take a few points, and then expand on it. It's very nice to visit the archives and to listen to what was presented impromptu on the moment, on the day, because it comes from the heart and it captures the true emotions that is hidden in all of us. I also, before I give the floor back to Pawanji to introduce our other speakers, I notice here amongst us, Dr. Abdul Salam. Abdul Salam is representing the Markaz group. Abdul Salam, namaskaram. And Abdul Salam is also representing the wishes of the Grand Mufti of India. So we are very, very fortunate and we are very delighted, sir, you have joined us today. And also I want to welcome Vaidya Naveen Gupta ji, former student. I see Naveen ji is here. Naveen ji, namaskar. I'm very happy to see you here. Former student of Tibia College. And Naveen ji, I hope you will share a few words with us later as we go into the program. I hope you will stay with us because all these wonderful contributions from our speakers surrounding where Unani system should go in the future, ideally. And we want as frank opinions as people. I can see so many other respected people here. Hakim, Rahul ji, namaskaram. Namaste.
Hakim Rahul, is from Bangladesh. Let me introduce him.
I don't know Bangla. I'm not good at Bangla, but
welcome.
He's from Bangladesh, so this is now international conference now.
International. Thank you. So Younis ji, number one, thank you so much for organizing and bringing. I know we are in touch. We've been sharing so much about rheumatoid arthritis. Yesterday, I was in fact with our colleagues in Toronto. We were discussing colchicine. I think there is one very, very important Unani preparation which is made from, which has colchicine. I don't know what I think the word that Suranjan. It's the same in Ayurveda and in Unani, and the effect is very powerful. Younis ji, before I give the floor to yourself via Pawan ji, I wonder if I can take 1 minute just to get a few words from Dr. Abdul Salam, who is the CEO for the Marcus Knowledge City in Calicut in Kerala. If Abdul Salam ji is listening, we would just like 1 or 2 words from you, sir.
They are doing
Marcus
great work.
Knowledge City is a very fascinating.
Yes, they are doing great work. They are doing great work.
Very, very fascinating work. And I hope we can all come around institutions like Marcus Knowledge City and their connections and their social contributions. You know, the work they do in the community is commendable. So I hope we can all, you know, think about all these strengths that we have. And Younis ji, you're already connecting with the traditional Iranian medicine group, and these are all very precious for us. So if Abdul Salam ji is not available, then Pawan ji, maybe Abdul Salam ji will join us a little later into.
Yes, sir. Yes, sir. Yes, sir.
We are having our.
We have dignitary here, sir.
Please,
Dr. Mohsin Khalid.
Sir, namaskar. Namaskar.
Dr. Mohsin Khalid, sir, is Assistant Drug Controller and Licensing Authority, Unani, Govt of NCT, New Delhi. So,
नमस्कार.
नमस्कार, स्वागतम जनाब. शुक्रिया, शुक्रिया. मोहसिन जी को बहुत बहुत शुक्रिया इतनी अच्छी डिग्निटरीज से परिचय कराने के लिए. आज की ये पूरी वेबिनार डॉक्टर मोहसिन देहलवी के नाम, आज की शाम आपके नाम.
सबका सपोर्ट.
थैंक यू, थैंक यू. वेलकम खालिद सर, वेलकम.
Pawan ji, are we going over to Younis ji or do we?
Khalid sir, first speaker was Khalid sir.
Khalid sir. Sir,
Dr.
namaste.
Khalid sir.
जी सर, बहुत बहुत शुक्रिया. अपनी अहम डिग्निटरीज के बीच कुछ सीखने का, सुनने का मौका देने के लिए एसोसिएशन को, पवन जी को, मोहसिन साहब को और दूसरी जो टीम है उन सब लोगों का बहुत बहुत शुक्रिया. जैसा कि और भी प्रोग्राम्स में हम लोग सुनते रहते हैं, देखते रहते हैं, एक बहुत बड़ी खिदमत है जो आप टिप के लिए, सेहत के लिए, समाज के लिए कर रहे हैं. जो आप मंथली शेड्यूल प्लेस करते हैं जब ग्रुप में, तो ऐसा लगता है कि आपकी नज़र सिर्फ आयुर्वेदा पे नहीं, सिर्फ यूनानी पे नहीं, सिर्फ आयुष पे नहीं, बल्कि मुल्क के और समाज के हर वो पहलू पे आपकी नज़र रहती है और आप चाहते हैं कि उन सब चीज़ों को सामने रखा जाए. मैंने अभी तक कभी किसी मेडिकल प्रोफेशन के किसी ग्रुप को इस तरह के वाइड ब्रॉड टॉपिक्स पे डिस्कशन करते हुए मैंने नहीं देखा है. तो इसके लिए आप सब लोगों को बहुत बहुत मुबारकबाद, पूरी टीम को. सीखने की उम्र ज़िंदगी भर रहती है और मैंने बड़े बड़े स्कॉलर्स और अथॉरिटीज़ से प्रोफेशनल फील्ड में ये कहते हुए सुना है कि मैं इस सिस्टम का एक तालिब इल्म हूँ, एक स्टूडेंट हूँ, और मैं भी अपने आप को यही समझता हूँ कि हर वक्त उम्र सीखने की होती है. और आज भी अभी सर मदन सर जिस तरह की बात बता रहे थे, तो ये यकीनन ये रोंगटे खड़े कर देने वाली बातें होती हैं कि हम आज जिस डे के लिए बैठे हैं, इनफैक्ट कोई भी डे हम क्यों मनाते हैं, उसका पर्पस क्या होता है, क्या सचमुच एक इवेंट के लिए ही ऐसा होता है? तो मेरे हिसाब से तो ये खर्च बिल्कुल बेकार है और इसका कोई पर्पस नहीं है इस इवेंट को करने का कि हम 1-2 घंटे के लिए किसी डे को मना लें. वेदर वो नेशनल डे हो, वर्ल्ड डे हो, इंटरनेशनल डे हो, उससे कोई फ़र्क नहीं पड़ता. तो अगर हम देखेंगे कि किसी भी डे को जो पर्पस होता है मनाने का, उसको सेलिब्रेट करने का, वो एक आपके लिए फ्लोर प्रोवाइड करता है अगले साल तक के आने का. और ये हमारी जिम्मेदारी है कि हम या तो आज ये तय करें कि आने वाले हम यूनानी डे तक क्या करने वाले हैं यूनानी के लिए, आयुष के लिए, इस समाज के लिए, या फिर ये कि हमने पिछले यूनानी डे से इस यूनानी डे तक क्या किया है, उसके बारे में हम असेसमेंट करें कि हमने यूनानी के लिए क्या किया, हमने आयुष के लिए क्या किया है. तो एक मेरी एक छोटी सी बात थी, चूँकि बहुत ही बड़े प्रेमियर और क्रीम लोग बैठे हैं इस ग्रुप में, एक जनरल लिसनर नहीं है हॉल में बैठा हुआ, तो इसलिए मैं ये बात अपनी कह रहा हूँ जो कि मेरा गर्द है। मैं भी उसमें शामिल हूँ, मैं सिस्टम का एक पार्ट हूँ। तो मुझे ऐसा लगता है कि और ज़रूरत है कि किसी भी डे को, चाहे वो हम आयुर्वेदा डे मनाएं, यूनानी डे मनाएं या कोई भी डे मनाएं, अगर उसका मकसद सचमुच हासिल करना है तो हमें एक रोड मैप बनाना होगा एटलीस्ट 1 साल के लिए, कि आने वाले यूनानी डे पे हम जब बैठें तो हम ये कह सकें कि हमने इस यूनानी डे में ये किया है और आने वाले यूनानी डे में हम और क्या करने वाले हैं। इस रेफरेंस को, जैसा कि सर बता रहे थे अभी, हकीम अजमल साहब के बारे में बहुत सारी बातें कही गई और सचमुच उनकी शख्सियत ऐसी थी कि 1 साल तक अगर आप उनके ज़िंदगी के हर पहलू के एक टॉपिक को लेके अगर आप सेमिनार कर ले तो शायद कम पड़ जाए, जहाँ तक मैंने पढ़ा है और मैंने सुना उनके बारे में। और हर बार जब हम सुनते हैं कुछ बात, तो ऐसा लगता है कि ये तो हमने पहले कभी सुना ही नहीं था। तो ये हकीम साहब की ज़िंदगी ही ऐसी है। 58 साल की उम्र में इतना सब कुछ दे जाना समाज को और इतना सब कुछ छोड़ जाना समाज के लिए। लेगेसी जो लोग छोड़ते हैं उनका अपना कुछ नहीं होता। आप देखिए हकीम साहब का अपना कुछ नहीं है। उनकी कब्र जहाँ पे है, उनका ग्रेव जहाँ पे है, वहाँ तक कुछ नहीं है उनके पास अपना सब कुछ। वो समाज के लिए और सिस्टम के लिए उन्होंने रखा। वो जिस तरह के दूरंदेश थे, जो उनका विज़न था, उस विज़न में लाइफ की बात इसलिए हो सकता है मेरी कोई बात रिपीट हो जाए, उसका पर्पस ये कहने का है कि हमें उनसे, उनकी इन्हीं बातों से ही सबक लेना है कि उन्होंने अगर कुछ सोचा, उन्होंने, आप देखिए कि वो एट ए टाइम 2 लड़ाई लड़ रहे थे। जिस वक्त हिंदुस्तान की आवाम मुल्क को आज़ाद कराने के लिए लड़ाई लड़ रही थी, उस आज़ादी की लड़ाई में भी वो शाना बशाना साथ चल रहे थे और एक तरफ अपनी सिस्टम के लिए लड़ाई लड़ रहे थे उन्हीं अंग्रेज़ों के साथ। आप इस पहलू को, उनकी ज़िंदगी के इस पहलू को सामने रखिए कि एक अंग्रेज़ से वो अपने सिस्टम को बचाने की लड़ाई लड़ रहे हैं, अपने मुल्क को आज़ाद करने की लड़ाई लड़ रहे हैं, और उसी अंग्रेज़ से, ये उनकी चालाकी, उनकी दानिशमंदी या उनका उनका ग्रेट विजनरी का एक एग्जाम्पल है कि उसी अंग्रेज़ से वो अपने उस इदारे की संग बुनियाद भी रखवाते हैं, ताकि उनको वो जवाब दे सके कि जिसको तुम अनसाइंटिफिक कह रहे हो, आपको पता होगा, यहाँ पे बातें हुई जब 1910 में जब उनका मेडिकल रजिस्ट्रेशन एक्ट लाया गया, वो एक बड़ी साजिश थी। सब लोग जानते हैं इस बात को कि उसमें जो हमारे देसी प्रैक्टिशनर्स थे, जो इंडियन सिस्टम या जो भी ट्रेडिशनल सिस्टम के प्रैक्टिशनर्स थे, उन पे नकेल लगाने के लिए वो एक्ट लाया गया था। और हकीम साहब की ये दूरंदेशी देखिए कि उन्होंने आयुर्वेदा और यूनानी को साथ रखा कि हम लोग अगर अलग अलग रहें तो हम बढ़ जाएंगे। उन्होंने आयुर्वेदा को सबसे पहले रखा, उन्होंने अपना बड़ा भाई माना और ये कहा कि आयुर्वेदा यूनानी मत करो, क्योंकि वो एक बहुत ही एक सेकुलर और सबको साथ लेके चलने वाले इंसान थे, जिसकी मिसाल बहुत सारी है जो अभी आप बता रहे थे कि एट ए टाइम आप उस वक्त हिंदुस्तान के जिस गोशे की टॉप मोस्ट ऑर्गेनाइजेशन थी उसके वो लीडर थे। तो इसका मतलब वो उन सब चीज़ों को लेके चलना चाह रहे थे और उन्होंने सबको साथ रखे प्लेटफॉर्म बनाया, एक तंजीब बनाई, ऑर्गेनाइजेशन बनाया और उसको लेके वो सबको साथ के चले और कामयाब भी हुए। आप देखेंगे उनकी ज़िंदगी में कि एक तरफ जहां उन्होंने यूरोप का सफ़र किया, अक्सर जिक्र आता है कि 2 बार वो यूरोप गए, तो आप देखेंगे कि वो ईस्टर्न कंट्रीज़ में भी गए थे। उन्होंने ईस्टर्न कंट्रीज़ के भी ट्रेडिशंस को, मेडिकल एथिक्स को, प्रैक्टिसेस को, साइंस को, तजर्बे को उन्होंने देखा। फिर वो यूरोप गए, वहाँ से भी वो चीज़ों को परख के आए और उन्होंने ये तरीका, उन्होंने ये इन चीज़ों को एक तरह से फॉर्मुलेट किया, एक निसाब बनाया, एक सिलेबस बनाया कि हमें अपने इस सिस्टम को अगर उस मुकाम तक उनके बराबर में लेके जाना है तो हमें उसी पैटर्न पे मनवाना होगा और उसी हिसाब से अपने रिसर्च को, अपने मॉडर्न टेक्निक्स को अपनाना होगा, ताकि हम उनके सामने हम मुकाबला कर सकें, उनके सामने हम फेस कर सकें, न सिर्फ फेस बल्कि हम उन्हें अपने सिस्टम को मनवा सकें। तो ये वो चीज़ें थी जो उनकी ज़िंदगी के उन 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 और एस्पेक्ट्स के हम रोशनी ले सकते हैं, हम फ़ायदा उठा सकते हैं। उसी तरह से हम ये बात कह सकते हैं कि वो न सिर्फ एक शख्सियत थी उनकी, न एक वो पर्सन थे, बल्कि वो पूरी ज़िंदगी उनकी एक अपने आप में एक ऑर्गेनाइजेशन थी, जिनसे हम सब लोगों को सबक लेने की ज़रूरत है। आप देखिए कि न सिर्फ उन्होंने तिबिया कॉलेज का क़याम किया, आपको पता होगा कि उन्होंने एक ऑर्फन के लिए एक इदारा भी शुरू किया था यतीम खाना के नाम से पुरानी दिल्ली के इलाके में। उन्होंने जनाना कॉलेज का क़याम किया था और तिबिया कॉलेज भी। तो आप देखिए उनका फोकस न सिर्फ ये कि हमारा सिस्टम था, बल्कि हमारा समाज, हमारी मिल्लत, हमारा मुल्क और हमारी पूरी इंसानियत, उन सब के लिए वो सोचते थे। और हम सब उनके बड़े एहसानमंद हैं कि उन्हीं खिदमात की वजह से हम लोग यहाँ इकट्ठा हुए हैं। और हम उम्मीद करते हैं कि उनके इन बातों से हम लोग लेसन्स लेंगे और अपने सिस्टम के लिए, अपने मुल्क के लिए एक रोड मैप तैयार करेंगे। और जो कुछ भी हम लोग इंडिविजुअल एंड ऑर्गेनाइजेशन लेवल पे कर सकते हैं वो हम लोग करेंगे। चूँकि वेबिनार का टाइम एक लिमिटेड रहता है, तो मैं चाहूँगा कि जो हमारे और सीनियर लोग हैं हम उनको टाइम दें और उनसे भी अपनी बात कहने का मौका दें और उनसे हम सीखें। बहुत बहुत शुक्रिया, बहुत बहुत मुबारक। थैंक यू।
बहुत बहुत शुक्रिया जनाब, बहुत बहुत शुक्रिया आपका। आपकी ओजस्वी वाणी में हम लोग बिल्कुल इंस्पायर्ड रहते हैं हमेशा। स्वागत है आपका जनाब, स्वागत है। नाउ आई वुड लाइक टू रिक्वेस्ट डॉक्टर यूनुस मुंशी जी, डिप्टी डायरेक्टर एंड हेड रीजनल रिसर्च इंस्टीट्यूट फॉर यूनानी मेडिसिन, कोलकाता, our friend, our resource, like Mohsin sir. Welcome.
Thank you, sir. Thank you very much. Good evening to all who have joined late, because we had already a discussion earlier. Here, as Khalid Sahab said, we are amongst the learned legends of Ayush, not only Unani, not only Ayurveda, but I see the international dignitaries who have excelled in Unani system of medicine or Ayurveda system or any other Ayush system of medicine. Basically, what Dr. Madan Saab said, the difficulties, then a dream, then how we can go forward with the Karolbagh college, which is a dream project of Hakim Ajmal Khan, and then how to go for international coordination and cooperation. And then what about the neighboring countries? So taking it one by one. Shall we go for the presentation also, or it is just like this?
No, you can. Platform is yours, sir.
You can please follow what you had in mind, and then when we come to discussions, maybe some of those other questions will also come out.
Just. So the Unani Day, which is a tribute to Masil Mulk Hakim Ajmal Khan, a lot of his achievements have been already discussed, and a lot will be discussed later on by Dr. Ghazala and others. I'm going to share the difficulties, what Dr. Madanji told, that there is one wrong concept amongst the population that our Unani system of medicine belongs to a particular sect or particular community. That I want to clear over here, because for the last couple of years, I'm trying to clear the things. Wherever I give the presentation, I start with the historic perspectives of Unani medicine. Basically, Unani medicine is the period from where there was a transformation from old traditional medicines towards a modern medicine. So in between this period, whatever happened is being attributed towards the Unani system of medicine. So these are all integration of somebody is doing something with the screen. Who is it? Please
sometimes
stop.
this is sometimes a problem. We have
Yes,
noticed
somebody's doing. I don't know whether
nobody can.
it is not deliberate. It might be by chance. So the traditional medical practices are still there. They were there, and when the medicine was practiced in temples and churches only, then came the era in 372 AD, when a knowledge city was established in Jundishapur, the Persian Empire. So it was from Jundishapur where all the literatures from different countries, including India, China, Egypt, they were all shifted to Jundishapur, whatever were available in every language, and they were translated into the Persian language, Pahlavi language. At that time it was called. The workers the scholars who worked on this were Christians, Jews, and Parsis. Since during that time, there were two empires, that is Roman Empire and Persian Empire, and they were always at loggerheads. They were on war in those days also. So at that time, in 4th century and 5th century, in between this period, the Roman Empire cracked down on Orthodox churches, and the scholars there also shifted to Jundishapur. And that, with these shifting of the scholars from all over the world to Jundishapur, made it a knowledge city, what I call. What happened in the Jundishapur, number one, translation of all the literature available to the Persian, what we call today as Persian, otherwise it was Pahlavi language, number one. Number two, establishment of School of Sciences. All the scientific knowledge was being taught in that university. It is this time also university there. So these things were out of way, because the science, the medicine, the religion, all these were taught in the temples and the churches only. Then this was a transformation from that particular era to new beginning of the science. It was.
I'm just wondering if you can somehow we can find a way to get rid of that niche jo laal wali line.
I don't know how we can get out of it. I'll see. Just a minute.
Thank you, sir. Because we want the recording it will look much better if it is.
I'll see if I can do it.
If you reload Chad, it will come. Thank you. Sorry to disturb. I'm also going to share in the chat box aapne jo hame diya paper ji. Wo I will just attach here for people who are.
Just a moment, sir. I'll do it.
Thank you. Please take your time, because we would rather have a clean screen. Thank you, sir.
Now it is clear. Now it is clear.
Thank you. Thank you very much. Thank you, sir.
And I have certain references where it has been written that one physician from Kerala shifted along with the literature to Jundishapur. But clear reference is that one scholar was deputed to India to seek the knowledge of Indian sciences, because there were certain established cultures during that time, and India was one amongst them in the world. Chinese, Indian, Egyptian. Basically, whenever the knowledge came to the world, it came through the sacred people. As we see, Hakim Luqman gave the knowledge of herbs. Then we have David, we call him Hazrat Dawood. He was bestowed with the knowledge of iron, how to use the iron. And Noah was given the knowledge of how to make the boat. So but the people, the scholars, they refined that. Whatever knowledge came to the world, they were the people who refined that. Those were the scholars. And the difficulty, that is what I am coming to. Main difficulty what we are facing is that this has been confined to a particular sect, particular community. Although this is a science, this is a knowledge of medicine, it should have not been, but unfortunately it is. And presently we are facing those difficulties, and nobody is responsible for that. It is we who are responsible for that, because we are propagating it like that. Otherwise, this has been started by Jews and Christians, even during the Muslim rule in Baghdad, when Jundishapur was closed down and a university in Baghdad came up. All the scholars from Jundishapur were shifted to I mean to say, during the period of Khalifa Harun Rashid, they were shifted to Baghdad. And it was the Jew from Jundishapur who established the Baghdad Shifa Khana, because hospital was already established in Jundishapur, which was called as Bimaristan. It is in Persian. Bimaristan means hospital. And when it shifted to Baghdad, it was called as Shifa Khana. Shifa Khana is Arabic word for the hospital. So three things which happened in Jundishapur during that time period, from 4th century, 5th century, and 6th century. It was establishment of a school, translation of the literature, then establishment of a hospital, full-fledged hospital. It was after, in the 8th century, that one generation of that Jew who, I think I am having the name over here, whose one generation became Muslim, and they still managed to run the hospital and School of Medicine in Baghdad also. Now coming to the dream. The dream of Ajmal Khan to do research and to integrate the Ayurveda and Unani together. Although that happened when Ayush came up, where all the systems were amalgamated, and a system which world knows now is the Ayush system of medicine. It includes Ayurveda, Yoga, Naturopathy, it includes Unani, Siddha, and Homeopathy. So that dream to do the scientific research and to go ahead with the integration was the dream of Hakim Ajmal Khan. He started scientific research in 1919, when he first took up, along with Salimuzzaman Siddiqui, the phytoceuticals he extracted from Rauwolfia serpentina. But what is my opinion, that phytoceuticals prove more toxic, I must say, instead of whole herb. Whole herb concept is the concept of Ayush, because you might be knowing Reserpine also, it was procured from Rauwolfia serpentina, Ajmaline, Ajmalanoon. They were the phytoceuticals which were extracted from Rauwolfia serpentina, but they never remained in the market for long because of their side effects. So it is because nature has already done a favor that whatever toxicity a plant is having, its antidote is always present in that plant only. This is the law of nature. So once you separate the phytoceutical, you separate the biomolecule, that doesn't, although that has having more efficacy, that is more efficacious, but at the same time that is also dangerous for health, which has been proved from time to time. Number one. Number two, we cannot, as our medicine, we believe in temperament of the medicine, temperament of the disease, temperament of the person, temperament of the environment. बीच में मैं ये बात कहूंगा that the present जो इस साल का यूनानी डे रखा गया है, the theme has been diet and dietotherapy. So I will be discussing that part also. So that dream, that to integrate the modern system, modern scientific lines, to go for the research on the modern scientific lines for the Ayush system of medicine. Although we are, I'm seeing in CCRM also and other organizations also, they are doing it. Undoubtedly, they are doing it. But what I can, that is my personal opinion, personal perception, that will not, that is why whatever we are finding in the laboratories doesn't prove it is metal when we go for the clinical trials. It is because of that. Number one, we don't know the temperament. Once we take the bioactivical out, it loses its temperament, whatever the herb was having. We don't know what temperament that bioactivical is having. Number one. Number two, that is proving more toxic than as a therapeutic agent. Although there has been, we have in Unani medicine extraction methods. We use arakiat, that is distils. That is also extraction. We use sharbat. Sharbat is also aqueous extract of the herbs. But they have given the quantity, they have given the herbs which will be taken as sharbat, which will be taken as majun, what will be taken as arakiat. Not all the medicine are taken like that. Now coming to the Karol Bagh, that how we can make that guiding force for the country. I think by making it Ayush University, that will be the main tribute to Hakim Ajmal Khan, because he has already integrated Ayurveda with Unani. If government of India can do a favor to the Ayush, to the Karol Bagh, to the Hakim Ajmal Khan, that college which is housed Ayurveda and Unani College in Karol Bagh, that can be transformed into Ayush University, as we are seeing that one or two Ayush universities have come up during this regime. Although this regime has been very much kind enough towards the Ayush, Honorable Prime Minister has done so much. And in the first instance, within the 3 months of coming to power, they created Ministry of Ayush. I think as much Ayush has got during this regime, it was not in the earlier regimes. So I should be thankful to the present regime, to the Honorable Prime Minister for doing so much for the Ayush system of medicine. 2 universities have already come up as University of Ayush, and I think the best contribution, best tribute to Hakim Ajmal Khan will be if we can transform that Karol Bagh Tibia College and Karol Bagh Ayurvedic and Unani College into the Ayush University. That will be the best tribute for him. Then coming to the international coordination and cooperation, what Dr. Madanji already, it can be at the individual level, as we are doing it. We have groups with the Iranian traditional medicine, and at present around 80 countries are practicing Unani system of medicine with different names. In our neighboring country, it is called as Eastern system of medicine. In Iran, it is called as Persian. Basics are same. They also teach based on the 4 humors, Avicenna's literature, Razi's literature. All these are same. Fundamentals are same, but name is different. They call it Eastern medicine. In Iran, it is called as Persian system of medicine. In Ugair, it is called as Ugair system of medicine. In other countries, in Qatar, in Kuwait, in UAE, they call it as Islamic system of medicine. So different names have been given to it. But as I quote Dr. Katoch, who was former advisor Ayurveda, he once told that it is 80 countries which are practicing where the Unani system of medicine is being practiced with different names. But then I must say that in a neighboring country, in Pakistan, they have established just 3 or 4 years ago, almost each state is having, they have the soba. I don't know what that can be called in English, but they have the colleges established there, even in Mirpur, in Quetta, in Peshawar. But there was earlier only one college which was converted into university, that was Hamdard Karachi and Hamdard Delhi. There were 2 Hamdards. Hamdard Karachi was established by brother of Hakim Abdul Hamid, Hakim Muhammad Saeed. He established Hamdard University Karachi and Hamdard Dawakhana there also. And same was one brother established Hamdard over here in India, and one brother established in Pakistan. Then in Bangladesh, Hamdard Delhi has established Hamdard Bangladesh. In Sri Lanka, Unani system is there. In Nepal, they are doing it. so in all these neighboring countries, they are doing all the what can be done for the Unani system of medicine. I think this is what I could have done. Rest is the are the basics of Unani system of medicine that everybody knows. Then how now coming to the diet, Unani system believes that if you are living in a particular area, you should take a diet what is being grown in that area, because that will be having same temperament what temperament the population is having. Number one. Number two, the food available in the season, fruits available in the season, vegetables available in the season should be taken in that season. No storage for the next season, because next season they will not be, they may produce disease instead of giving you the health. Number three, Unani system has, there is a vast concept of diet in Unani system of medicine. We have Ghazai Latif, light diet, Ghazai Kasif, Zud Hazm Ghaza, then it is so much vast that every disease what has been mentioned in United States of medicine, whether it is in Halabi, whether it is in Firdaus Hikmah, wherever it is mentioned, the diet pattern has already been given along with the disease. Since I have worked on diet project in my PG, I had worked for the diet in arthritis. I have seen that what Unani system has told that Ghaza bil misl, the disease जो temperament disease का है उसी temperament का उनको गुजाए देनी चाहिए. Then दवा भी जिद, तो treatment should be done जो temperament disease का है उसके opposite temperament की दवाई दे दीजिए, लेकिन गजाए वैसी देनी चाहिए. Now I will give you the example. In arthritis I have seen, I have जो मेरा survey चला है in Delhi and in Kashmir, I have seen that चूंकि arthritis जो है वो सर्द मिजाज की बीमारी है, तो जो गर्म मिजाज की गजाएं हैं like pulses and red meat, they are creating problems, they aggravate the symptoms. While as the bird meat that has been prescribed in Al-Hawi Fittib, that you can take bird meat but not red meat. Then fish and bird meat, although they are also rich in proteins, but they never create any problem for the arthritis. So Ghaza bil misl and dawa bil zid, this has been validated by my study which I conducted during my one of the projects. And even fasting has improved the symptoms of arthritis. There had been studies in Norway, Oslo, that they made fasting people to fast, and then gradually they have given them the diet of this kind, that kind in the groups, and they have seen the effect of the diet in arthritis. I have taken just one disease. Other diseases also have the relation with the diet. We have seen diabetes, cardiovascular diseases, even liver diseases, where diet has a major role to play in the aggravation of the disease and even in the elevation of the symptoms. So this is what I could say, because I don't want to take the more time of the 4 hour here, because our teachers are also waiting for the presentations, and I think we should be more listeners and not the speakers. So as Khalid Sahab told, that I am also the student of Unani Medicine. Even after spending my 30 years in United States of Medicine, I see that I am still at the point level what I have learned from in the United System of Medicine. It is an ocean, and I have just taken a drop out of it. Thank you very much, sir. Thanks a lot. Now the floor is yours.
Thank you very much.
Thanks.
Excellent. You have covered everything. What you left, nothing. Excellent. Yeah. Madan sir.
Younis ji, thank you so much. You have brought this historic perspective into great relevance, the importance of the knowledge city and the historic thing. Thank you for sharing that paper. I have put this in the chat box for everybody to access it. I've also been discussing about rheumatoid arthritis, your work in the north of India, and your observation about the link. We have discussed briefly about the link between the Rajma, that means the beans, and some problem with triggering inflammation in the system. These are very important clues, population level data, and I hope we can revisit this. I mentioned we will connect with our friends in Pune, Arthritis Center in Pune, and there are many leads here. Thank you for highlighting the other very, very important point about thinking about the university status for Karol Bagh, for Tibia College. And I think there will be many people who will admire you for being so passionate about raising that point. Particularly, I feel this is something that should happen. Perhaps collectively, we will approach Manchandaji to prepare a little concept note on what else is needed to make this happen. I think in 2 years' time, I think the Unani College in Aligarh is celebrating the centenary. I think I might be correct. You will have to look at the dates. One of your scholars who was with us in an earlier program, we discussed the big centenary celebration in Aligarh also to look at some of these things. So I think you have given us a lot of things to think about, and particularly the call for converting, for having an Ayush University in Delhi, in Karol Bagh, to convert this historic institution into something that is good for the whole world. We will reconnect with you, sir. Thank you so much for raising that point. Pawanji, please stay with us because we want you to continue.
So now I would like to invite Dr. Ajmal KT, founder of Hermas, Unani Herbal Pharmaceuticals, Director-Markaz Unani Medical College, Chief Hakim, Calicut Unani Hospital and Research Center, a dignitary from Unani. We would like to welcome you, sir. Welcome.
Sir, one thing I will tell you, he is the only person who is academician, entrepreneur, physician, everything in one man. It's a one-man show.
Great.
Welcome to this event. Thank you so much for finding time to be with us today. And Munshi, thank you again for connecting us with such wonderful people. Namaste.
Mohsin sir.
I think he's about to join us. He was driving back. He'll just join us. So I think we should start with Dr.
Yes, Ghazala ji. I would like to request Professor Ghazala Mulla ji. Welcome, Madam Khushamadid, Head of the Department, ZBM, Unani Medical College and Hospital, Pune. Welcome, Madam. Welcome.
Ghazala ji, namaskar. Assalamu alaikum.
Good evening to you all, and I once again thank Dr. Mohsin Sahab and the Independent Research Ethics Committee again to join with you all people and to share my views about Hakim Ajmal Sahab. So to begin with, here I'm sharing my screen so that my screen is visible to you all, sir?
Clear, madam. Very clear. Thank you.
Okay, so I have chosen a topic, Hakim Ajmal Khan and his perspective about pandemic. So, and why I have selected this topic as I'll proceed to my further slides, we will come to know that why I have chosen this topic, that what is the perspective and what line of treatment Hakim Ajmal Khan Sahab has advised for pandemic, or you can say for common cold and for viral fever and for viral diseases. So in Unani, we can say there is no such a concept of viral disease or bacterial disease. It depends upon the humors or akhlaq. But certainly, we should be, you can say, exploring the bioactive ingredients of the medicine which he has prescribed for the treatment of viral fevers or for the treatment of the pandemic diseases. So to begin with, I'll just elaborate, or you can say in a very brief, I just want to highlight about Hakim Ajmal Khan Sahab. So the ages of Unani system of medicine can be, you can say, divided into three era. That is Ahde Atiq, from Bukrat to Ibn Sina, and Dore Abbasi and Banu Umayya, that is the middle age, and Dore Jadid, that is the present era, that is from 17th century to till date. So these, you can say the whole of the Unani system of medicine era can be divided into these three categories. When we look at the Khandani Sharifi, a distinguished lineage of Unani Hakims. So here we are having Hakim Muhammad Sharif Khan. So he's a great grandfather of Masih Mulk Hakim Ajmal Khan Sahab. And then we are having Hakim Mahmud Khan Sahab, who is the father of Hakim Ajmal Khan Sahab. And then we are having the Masihul Mulk. So we are having here the three generations in Khandani Sharifi. So when we look at the, you can say, birth date of Hakim Ajmal Khan, it is the 11th February, and he died on 20th December 1927 at the age of 59 in Delhi. And his notable work, as already the senior speakers, they have, you can say, elaborated about his lifespan. So I'm not going to deliver much about his, you can say, biography. Here, the most notable work is that he's a Bioactive and Nishat Sania. So Hakim Ajmal Khan is a pioneer of Unani medicine in modern India. He renounced the title he had been given, which was Hazikul Mulk, to accept the title that the Indian people gave to him, which was Masihul Mulk, that is the healer of the nation. He founded the Madrasa Tibbiya School of Tib in Delhi in 1890, which was finally inaugurated in 1921, along with his brother Hakim Abdul Majid Khan and Hakim Wasil Khan. This institute became the medical college in Delhi, which already Younis Munshi Sahab has elaborated. Now, there is an Hakim Ajmal Khan Sahab Award. The Central Council of Indian Medicine instituted Hakim Ajmal Khan Award Fund in 2014 to perpetuate his memory, to recognize the best talents in field of Unani. The fund is registered under the Societies Registration Act 1860, and the fund invites nomination in respect of statesmanship of the highest order of our country in the field of Unani. Eminent persons in Unani science, eminent Unani teacher, as provided under the memorandum of association of this society. The award is of value of ₹1 lakh and the medal for their outstanding services in the field of Unani. Now, coming to my main topic about his perspective on pandemic. It is a very, you can say, strange coincidence in the sense that in 1980, there was a pandemic in India also. And again, we can say in 2020, we are having a pandemic breakout. So during the lockdown on March 24th, 2020, I have come across a Facebook post in which it is written that in 1980, in India, there was an outbreak of pandemic, and people are dying, or the rate of mortality was very high at that time. So what Hakim Ajmal Khan Sahab did, he formulated one nuskha or one formulation, and he make a decoction or joshanda of it in a very big dags like this, and he kept these dags of joshanda or of decoction along the roadside of the Delhi city at that time, and he advised people to drink this joshanda whenever they want, and after drinking this joshanda, the severity of the disease, or you can say the people they do not land into the complications of that pandemic. And here in this post, there was a nuskha suggested by Hakim Ajmal Sahab, and he said that he advised to take this Joshanda or decoction for 10 days. So I am here displaying the content of the Joshanda. So it is the Unani name. There are only 1, 2, 3, 4, 5, 6 medicines, herbal medicines are there. So the first content of that Joshanda is Safarjal or Behidana. The botanical name is Cydonia oblonga, and the quantity to be added in the Joshanda is 3 masha, that is 2.916, or it is, we can say, approximately 3 gram. Unnam, Ziziphus jojoba, we have to take 5 in quantity. Sapista, that is Cordia latifolia, we should take 9 in number. Gule nilofer, that is Nymphia lotus, 5 masha, or approximately around 5 gram. Khaksi, Sisimbarium iori, it is 5 masha, that is 5 gram approximately. And Aslusus muleti, that is Glycyrrhiza glabra, 5 masha we have to take. Now, when you look at the mode of action of all these drugs, we can say that the first is Behidana, yeah, Lobe Behidana. So we can say it is the mucilage. So you have to soak the seed in water, and the mucilage is called as lob. So that we have to use. So in Unani book, it is indicated for dry cough, cold, runny nose, and for dryness of throat and different types of fever. And the temperament of this drug is cold and wet. Whereas the second content is unnam. The temperament of this medicine is garmtar, that is hot and wet, and its decoction is used for common cold, for cough, and for you can say productive cough. And it is also used in cases of pleurisy and in cases of pneumonia. The next content is Gulenilopa, the temperament of which is Garmtar, and it has got antipyretic, expectorant, and expectorant property, and it is used in common cold and cough and cold. The next is Mulethi or Aslusus. All you must be knowing about it. So it is used in dry cough, irritation of the throat, irritation of the chest, dry cough, we can use it. And for Sapista, as I said, it has got the temperament of, it is, you can say, not too hot, not too cold in temperament, and the wetness is of degree 1. Okay. And it is also used for as an expectorant. So these are, you can say, the Unani, the mode of action or the indications as per the Unani books. Now, when we look at the bioactive ingredients of these, you can say, individual medicine or individual herbs. So when we look at the safarjal or behidana, so the seeds of which are brown, actually the safarjal is a fruit, and just like an apple, and in that we are having the seeds. So the seeds, it contain about 27 polyphenolic compounds, and these polyphenolic compounds, they are having a demulcent activity, or they are having soothing effect for the mucous membrane. Okay. So, and an infusion of the fruits of the seeds of Cydonia oblonga is used as a demulcent mucous membrane protector. It has got antidiarrheal agent, and it is diuretic, and has traditionally been indicated to treat gastritis, gastroduodenal ulcer, irritable bowel syndrome, diarrhea, and specifically for colds, pharyngitis, and bronchitis. It has got antioxidant and anti-inflammatory property in the seeds of Cydonia oblonga. It has got so many phenolic compounds, and these phenolic compounds are especially having the anti-inflammatory, antioxidant property, and they are, you can say, can be used safely in cardiovascular diseases. It can be used in cough, and it has got antimicrobial property. So, and the next is, this is the, you can say, the fruit of Safarjal. The next is Unnab. So when I have searched the literature for Unnab or Ziziphus jojoba, it has got anti-allergic and anti-anaphylactic activity. It has got antihistamine activity. Okay, and there are so many flavonoids are also present. They have got the antimicrobial activity, and it has got alkaloids, flavonoids, saponin in Ziziphus jojoba extracts, and they have got antimicrobial activity. So this is about Unnab. And then the Sapista, the third content, Cordia latifolia. So the one study, it analyzed the qualitative analysis, and the qualitative analysis revealed the presence of alkaloids, flavonoids, terpenoids, steroids, saponins, tannins, carbohydrate, protein, etc. So what is the importance of these flavonoids and alkaloids? They have got antimicrobial activity. So even if we look at this formulation, or look at the content of this Joshanda in terms of the bioactive ingredients, or you can say the scientific way, if we look at this, again they have got the activity which is which is active against you can say antiviral diseases, or against the respiratory tract infections. The next is Siberium iori, that is Khapsi. So here again, the qualitative phytochemical analysis shows the presence of flavonoids and phenols in all the extracts. So again, the phytochemical compound in the plant parts were recognized to be biologically active compounds, and they have got again antimicrobial, antioxidant, antifungal, and anti-cancer activity. The terpenoids which are present in the Khapsi, they show antiviral activity, and it has got antibacterial, anti-malarial, and again anti-inflammatory activity. So we can say that these Joshanda, or this Joshanda, can be safely used in upper respiratory tract and even in lower respiratory tract infection. Hakim Ajmal Khan not only just prescribed the Joshanda, but he has also prescribed compound formulation, ya murakkabat, and he said, this is, I have displayed the page of book Hazik, and in this book of Hazik, it is written that Mujarrabat Masihul Mulk Hakim Ajmal Khan Sahab, and here he has advised to take Khamira Gauzaba 1 tablespoon, that is around 10 gram, with Warkenukura, and along with this Khamira Gauzaba, he advised to take decoction, and the decoction should contain Gauzaba 3 masha, Gule Gauzaba 3 masha, and Abresham Mukarras 3 masha, and Nabat Safed, that is the Shakar 20 gram. And we have to add water in this, and we have to make a decoction of it. And every morning, the person who is having, you can say, a viral infection, he should be taking this Khamira Gauzaba 1 tablespoon along with decoction every morning, at least for 10 days. Then another formulation to be taken at night, it is Lauke Motadil 10 gram, Lauke Sapista 10 gram, and Arke Gauzaba 120 ml. It should be taken at 9. Now, if the person get cured with the viral infection, and if there is a, you can say, weakness, so in case of general debility, when cough subsides, so what we have to do, as per the instruction of Hakim Ajmal Khan Sahab, we should take 1 tablet or 1 Habbe Jawahar, 1 tablet, and we have to, you can say, rub it, और या जिसे कहते हैं हमें से घिसना चाहिए, we have to rub it and mix it with Khamira Abresham 5 masha, and it is to be given twice, morning and night, along with the above Joshanda, that is Lauke Motadil and Lauke Sapista. So this is how it should be taken to cure general debility. And the diet for the person who is having viral diseases or viral infection, the person should take light diet like soups and khichdi, moong ki dal, barley water, and instead of water, the person should be given lukewarm R.K. Mako and R.K. Gauzaba. So this is from book Hazik, page number 62 to 69. So this is a very, you can say, my small presentation about Hakim Ajmal Khan Sahab's advice in cases of viral infections. So thank you once again for giving me an opportunity to present my views over here. Thank you very much.
Ghazala ji, thank you so much for taking us into the depths of what is happening today, the problem of the pandemic, also taking us into the depths of what one given formulation and the different plants that you have described there, which is very, very important. When I look at the names of all those ingredients that you have listed, there are a lot of anti-inflammatory compounds there. What is a question for you is, are all these formulations still being prepared in by individuals or by small companies?
Yes,
Because
yes, sir. Yes, sir. They are commonly used by people, and nowadays, usually what people were initially thinking that ये बहुत झंझट का काम है to take all those medicine and to then soak them overnight and then boil them. But this pandemic, they have, you can say, मजबूर किया उन लोगों को कि they should be taking this Joshanda, and you won't believe, sir, people are searching for this Joshanda. We should have this Joshanda, and I'm not promoting Dehlvi Saab's Joshanda over here, but it is a ready-made Joshanda, very effective, and people are coming to the clinic and they are taking very happily. Even small children, they are also ready to drink this Joshanda, so they are very effective.
This comes now in supply. This Joshanda comes in supply from CCRM also into the OPDs, and we are celebrating India at 75, and we are distributing free. And I have been given target of 1,000 people to be distributed this Joshanda and Khamire Marwarid.
Ghazala ji, Younis ji, हमारी तरफ से I have one question. एक छोटा सा, आपने the use of Ziziphus, इसमें आपकी किताबों में जी कितने, do you give details कि कौन सी variety Ziziphus अगर देखो, मोशन जी की तरफ भी है question कि Ziziphus की तरफ देखो तो इतनी varieties पड़ा है, so many varieties. हम हिंदी में बेर कहते हैं, बेर, क्यों अब इतनी varieties पड़ा, शायद आपकी किताबों में कुछ there might be some information कि कौन सी variety use करना है, इसकी कुछ है जी आपके in your texts, Mohsin ji, Ghazala ji, Younis ji?
We are using Ziziphus jujuba. In Kashmir, I once saw the bear, but that is equally effective. But that variety is not available in Delhi.
Thank you. It's an important question. I will tell you maybe offline for us.
I'll just intervene. Once Hamdard Hakim Abdul Hamid came to Kashmir, and he was of the opinion that we'll take a contract farming of this Ziziphus variety of Kashmir. Ziziphus variety of Kashmir. He talked to the politicians, also to the rulers at that time, but I don't know what happened to the project. Then I'm not aware of that. But that was a project of Hamdard to take contract farming of Ziziphus in the area, particular area that is called Lar. It is on the name of Lawrence. Yeah, that is called Lar. That is town, and that is the taluk this time. In the tribal areas of that, it grows there only.
Thank you. I mean, I think Pawan ji, I think
I welcome Dr. Arman from Tehran. Welcome, Dr. Arman.
I don't know. I just asking them to wave their hands because what they have joined, I don't know. I'm just messaging.
Thank you.
By the way, Mohsin bhai, this is Bihi. What I'm eating is Bihi.
Amina ji, thank you for connecting us to so many wonderful people from around the world.
Arman, if you're there, can you unmute yourself and just say hello? Arman is in charge of School of Persian Medicine from Iran. He is also the Dean of International Affairs from University of Tehran, Health Sciences Tehran. And we've always been discussing the Persian civilization and history of medicine. how the medicine changed across the Silk Route and how it got imbibed. Like Madanji was saying that Unani has 3 schools in India, but unfortunately I can say that Unani has changed its course of school of thoughts as it went to the Eastern India and the Western India and the Southern India by involving the medical systems where the civilizations began. So Arman and there's a very beautiful museum in Tehran. So every time Arman, we have the same lamps, the same, like the small, what is called, we call it as valla or something, vellam, the small one, you put it for the kids, the small tapering ones. Arman has had collected about hundreds of it from different parts of Iran. It's similar much here. Arman, if you are there, I think he is there. I just saw him here. Arman. So he can just say hello. So Arman and Idris is from Pakistan. Dr. Hakim Idris Khan is the Dean of Eastern Medicine from University of Karachi. So I asked both of them to join. So they have joined.
Is Dr. Idris here?
I don't see them. Maybe they are off and on as they are traveling back.
Thank you.
It's also the time difference, and it was like Madanji, I just sent it as a meeting started because even Madanji asked me to join just as the meeting started. He sent me the link and they said join. I just joined. I don't know anything. I asked Mohsin bhai, what is this? I mean, that's how it is. And thank you again, seeing all the old faces.
Thank you for being. Thank you for being.
If Hakim Ruhul, can throw some light on what is happening in Bangladesh.
Oh, thank you, sir. Thank you. Please, could we have
Ruhul, he's among the participants, I think so.
I can see Rahul. Rahul,
he's there. If he's listening to us, please have some.
You will have to unmute. We want to hear your situation in Bangladesh, please. Welcome to the.
Sir, one speaker is left, sir. Dr. Ajmal KT.
You see,
Assalamu alaikum and good evening to all. I'm from Bangladesh. In Bangladesh, Unani Medicine is developing very well. And in Bangladesh, there is one government university and one private university. There are 27 diploma colleges in Bangladesh. And the people of Bangladesh are very much interested in Unani and Ayurveda medicine. And also our government is very interested in this system of medicines. And in Bangladesh, in 1930, we established, they established a Unani Medical College in Dhaka. It was established by a renowned Unani physician, Hakim Habibur Rahman Khan Akhundzada. I think many of you have heard about him. And we are trying very hard to develop Unani system of medicine here. And actually, in Bangladesh, a lot of books are in Arabic and Persian and Urdu. And in Bangla, we have almost 7 to 10 books we have translated. But still now we have to depend on the books of Persian or Arabic or on Urdu books. That's why actually it is true. We're trying, but as our language is Bangla, that's why we have to struggle very much. I think as from India, we are getting much help from also from Ayush member, also visited Bangladesh, and we have more with Jamia Hamdard in Bangladesh, Hamdard University. I think if you promote us, if you help us, we will go faster, inshallah. Thank you very much for.
I think last year CCRM had done one MOU with Hamdard, Bangladesh, and there has been established a Unani chair in Bangladesh, and Dr. Kazmi has been selected for to be chairperson of that chair. I think this is the recent development what I am aware of, and I wish that let Bangladesh translate all the books into Bangla, as CCRM has already is doing. They are translating from Persian to and Arabic to Urdu and English, and in the same way, let Bangladesh also start the projects to translate all these books into Bangla. And naturally, this is the universal. I am telling that what I tell always in the forums also. Unani is the global system of medicine, and it should be translated in every language, whatever is available in the globe. Thank you very much. Thank you, sir.
Thank you, sir.
Our last speaker from Kerala is here with us. I can't see the name here. So, Hakim, Rahulji, thank you so much for joining us from Bangladesh. I don't know where you are located in Bangladesh. Where are you, sir?
Yeah, I am from Dhaka.
Dhaka, thank you.
The capital of Bangladesh.
Thank you so much for joining us. You can see this international community and how we are interacting and how we are linking. Thank you.
I also thank you all.
Thank you all. Thank you so much for joining us. I wanted, Arman Ji is here. Arman Ji, before we go to, I just want to see if our last speaker has arrived here with us. If not, after Arman Ji, Amina, I don't know if Arman is here with us.
Is there next to you.
Oh.
He's with his face mask. I think he's standing outside the building.
Okay. Arman Ji, welcome you. Thank you so much for joining us today.
Yeah, Arman, now we can recognize you. With the mask, we cannot recognize you.
Hello,
Arman,
everyone.
the floor is yours. Thank you for joining us today. Where are you today? Which part of the world are you today?
Hello, everyone. I am in Tehran now. Sorry, I am going to another meeting today. I have too much meeting and a hectic day. But I only joined you to say congratulations for this good day and Unani Day to all of my friends in India, in Bangladesh, and everywhere. And hope the best for you and your very good jobs in the field of traditional medicine in India and other countries. And hope see you soon after the pandemic in Tehran or in India or other countries.
Thank you. Bye-bye.
You're welcome. Bye-bye.
Thank you. We look forward to staying in touch and then discussing some plans for the future. Thank you, Arman. Now, if our last speaker is not here, I just want to give the floor to Naveen Ji Gupta Ji. Naveen Ji, namaskar. Naveen Ji is a former student, as he has put in the chat box, a former student of Tibia College, but Ayurveda graduate. And Naveen Ji, namaskar. Naveen Ji will give us a little more insight into Tibia College when he was a student there, the seniors there, and also perhaps Naveen Ji also has some ideas in his mind of where Tibia College should go. As a former student, we are very privileged. We're very happy to have you here with us, Naveen Ji, please. Naveen Ji, the floor is yours. Naveen Ji has left us, I think. Naveen Ji is not here with us. I'm sorry.
We don't see him in the participants list, Madan Ji.
Younis Ji, I just want to come back to you because you've been very clear in that one point about furthering the status of Karol Bagh Tibia College. Looks like you have been thinking about this in recent.
Surely, that will be the tribute to the legendary. If that becomes Ayush University, and every system of medicine is taught over there, including Siddha, homeopathy, and other systems, whatever we have, yoga, naturopathy. It must come as Ayush University in the capital of our country. That will serve the purpose.
Thank you for now. You are closer to the policy making circles in Delhi because you're heading or looking after an institution. Has this discussion started somewhere in Delhi or in?
It was once taken up during our Unani Day celebration in I think 2 years back, when this came up, and different organizations, including All India Unani Congress, World Unani Foundation, they are striving for this establishing of university in Ayush University in Karol Bagh. But how far we have reached, because I'm sitting in the eastern corner of the country, and I'm looking after my institute only, and then the first priority is the local institute which I'm heading this time. And if the things go on well, we may see to other policy matters. But since we have Dr. Khalid over here, who sees the policies in NCR of Delhi, who is part and parcel of the policies regarding Unani system of medicine, and Mohsin ji, who is there in some committees of Ayush Ministry. Even for that matter, we have this Dr. Pawan ji, whose struggle for mercury to be permitted brought some fruits when the notification was passed recently by the Ministry of Ayush. So people can definitely help us to bring this dream into the reality. I think so.
Thank you. I think Khalid ji is still here with us. I don't know if Khalid ji would like to share a few words, or Mohsin ji wants to share a few words before we go to. I can see a new name here in our gathering, Parvez Ahmad Khan. Parvez ji, namaste. But I don't know if Mohsin ji wants to add a few more lines to this, this important thought that Younis ji has just crystallized for us.
Demand for creating a university has been going on for converting the college into a university, full-fledged university. It's going on. Representation is given to the Delhi government. I think a lot of associations have given this, but no movement so far has happened. But we are still at the job. Let us see that someday they will definitely convert this into a university. A lot of encroachments have also taken place in the college. For that also we filed an RTI, got some information out also. So this fight is going to be a long one, but nevertheless, we are going to fight for it.
It is a very valuable location, a lot of land associated with it. I'm putting it very bluntly that there are now universities, transdisciplinary university in Bangalore is one university that runs out of a very small campus, less than 10 acres of land. And you can see the structure of that university. And it's a state university, state of Karnataka, and a lot of patronage from other people. I wish this dialogue, I mean, you people are sitting in Delhi, and the time is ripe for taking this discussion, the Unani discussion, to Geneva and other locations. As Munshi ji just mentioned, that at least 80 plus countries are using this system on a daily basis. And there is no reason why we cannot justify a little more action in that space, both at the global level and also at the national level. And as I said, this is a forum where we are expressing our views. The discussions are archived, we can revisit and then analyze, and it will help us think through what we need to do. So I wanted, number one, thank Mohsin ji, thanks Younis ji for adding a little more to this thinking. I wish we had some more people. I don't know if there is anybody from Aligarh here or from Lucknow. I don't know if there is somebody here just to get some thoughts on what is on their minds also. I don't know if Khalidji is still here. Khalidji, if Khalidji can add a few words about this, then that will be, we will like
Thank you, sir.
आपकी तरफ से थोड़ा सोच जी कि कैसे करें इसको आगे थोड़ा करना हो तो
मैं चूंकि खुद उस सिस्टम में हूँ तो पॉलिसी मैटर्स एंड डिसीजंस पे तो मैं कोई कमेंट या कुछ नहीं बोल सकता, लेकिन एक बात जो इससे पहले एक सेशन में मैं था आपके प्रोग्राम में मरकरी वाले पे और एक और NABL एक्रेडिटेशन पे, तो मुझे आपका बहुत ज़्यादा तिब्बिया कॉलेज से बैकग्राउंड तो नहीं मालूम, लेकिन जहाँ तक हमने पढ़ा है मदन सर के बारे में, तो जो तिब्बिया कॉलेज से और करोल बाग से आपका दर्द है और आपकी फिक्र है वो यकीनन यूनानी आयुर्वेदिक सिस्टम के स्टेक होल्डर्स के लिए बहुत बड़ी बात है कि आप पिछले मरतबा भी जब इदरीस साहब स्पीच दे रहे थे उसके बाद आपने, हालांकि उस टॉपिक से रिलेटेड वो प्रोग्राम नहीं था, फिर भी आपने तिब्बिया कॉलेज के लिए, यूनिवर्सिटी के लिए आपके एक लफ्ज़ में वो दर्द और वो फिक्र झलकती है, जो हम लोगों के लिए बहुत ही एक मोटिवेटिंग है कि हम लोगों को भी उसके लिए कोशिश करना चाहिए। मैं बहैसियत एक सिस्टम के स्टूडेंट के मेरी दिली ख्वाहिश होगी कि वो यूनिवर्सिटी का दर्जा मिले, उसको एक कैंपस का दर्जा मिले और वो एक गेटेड कॉम्प्लेक्स हो, उसमें कई सारे यूनानी से रिलेटेड कोर्सेज शुरू हों, उसमें रिसर्च शुरू हो, वहाँ पे एक स्टेट ऑफ द आर्ट लेबोरेटरी हो, वहाँ पे जो उसकी शुरुआत है, जिस वक्त उसकी शुरुआत हुई थी, उस वक्त की तारीख जब आदमी पढ़ता है, जब सुनता है, तो ऐसा लगता है कि हम एक ड्रीम देख रहे हैं कि ऐसा भी उस जमाने में रिसर्च का काम होता रहा होगा किसी यूनानी के इंस्टीट्यूशन में। अगर वो वक्त भी वापस आ जाए तो वो भी उसके लिए एक बहुत बड़ा कंट्रीब्यूशन होगा हम लोगों की तरफ से। अब इस ज़िम्न में क्या कर सकते हैं, वो बहुत सारी ऑर्गेनाइजेशंस कोशिश कर रही हैं और कई सारे प्रोग्राम्स में इस पे बात की गई है। अब उसका स्टेटस क्या है ये इस वक्त हमको नहीं पता, शायद उसके बारे में और कुछ मालूम करने की ज़रूरत है, लेकिन आपकी जो ये ख्वाहिश है और ये जो आपका एक जज्बा है, ये अपने आप में काबिल सताइश और काबिल मुबारकबाद है। और मैं बहैसियत यूनानी के सर आपका बहुत बहुत शुक्रिया अदा करता हूँ कि शायद आपके इस कोशिश से कुछ ना कुछ अच्छा ज़रूर निकले।
थैंक यू जी, थैंक यू जी। गजाला जी, आपकी तरफ से कुछ थोड़ा बताना जी, आपकी पुणे में और क्या चल रहा है, शायद आपकी कुछ इंटरेक्शन हो पुणे हमारी यूनिवर्सिटी वालों के साथ कुछ हो, क्योंकि हमारे भूषण साहब है, भूषण पटवर्धन जी है वहाँ पुणे में, उनके उस
yes, Bhushan Patwardhan says the health department, and they are having a center of excellence of Ayurveda. So every year I go to there, and I'm having one lecture on introduction of Unani system of medicine, and I personally met him once in his department because he's very busy. So the in charge is Girish Tillu, Dr. Girish Tillu, and he has guided me for my project, EMR project on Ayush, where I have been working for the genotypic study of temperament. So I have completed my project, and they have helped me a lot. Bhushan Patwardhan sir and Girish Tillu sir, they have helped me a lot. And at our college, I'm having 3 research projects in collaboration with Bharati Vidyapith in Pune, where we are doing the study on liver cancer and uterine cervical cancer with Unani formulation. And recently, our college,
there is a sorry to interrupt here. आपने जो कैंसर की बात बताया, there is an ongoing discussion with the National Cancer Institute America, National NIH की. I want to come back to this point, but I can see I just want to break the discussion here a little bit. because I can see Naveen ji is here. Naveen ji is very special for us because Naveen ji studied in Tibia College. And I just want to hear, Naveen ji, aapki taraf se, you are an old student of Tibia College.
Yes.
Younis ji has just mentioned कि इसको university status, you must think about this. आपकी तरफ से थोड़ा बताना जी.
Okay, good afternoon to everybody. I'm in London, and I'm an Ayurveda physician from Delhi University. I finished my graduation in 1983, and when I got admitted in 1977, then we had BAMS and BUMS. And prior to that, it was mandatory to have pre-Tib and pre-Ayurved. And incidentally, both the batches in Tibia College of pre-Tib and pre-Ayurved, we used to sit in one classroom. Later on, when we divided into BAMS and BUMS, then we had separated ourselves. I mean, we had different classrooms, but and then we stayed 5 years together, and then we had a dispensary. So I think one of my 2 years junior, he has become principal of my college, and then my class fellow. And so I know a couple of people who have been director of CCR, Center for Research in Unani Medicine, somewhere in Aligarh, I think. And then Idris was my class fellow. He was principal. And then Yusuf Zamal, he was my junior. I think he was also professor in I don't know Kai Chikitsa in, how do you call it? Anyway, my experience with Unani is also a little bit good with my dispensary, because in my college, we had a rotatory internship, and I was very interested because of these all Majun and all something different preparation than we used to have in Ayurveda. So I used to sit in the dispensary with my class fellows, and then the medicines which really touched me a lot, and we had a very good results. I can mention a few of them. That one was that Khamira Gajwa, Ambari, Jawahar Wala Khas. And I had a very good experience in neurasthenia, post-paralytic patients. We were doing so good. And also the heart patients. And then Habbe Suranjan, as you were mentioning in the beginning of and then Habbe Suranjan was working for, everybody is knowing, everybody is expert of the medicine. I'm not expert of Unani medicine, but I'm in Europe for so long years. And I do have a colleague in Netherlands, because we had a association of Ayurveda Professional Association Netherlands, which I was vice chairman for a few years. And one of my colleagues, he has written a book on Unani medicine. He's a Dutchman. And I just forgot his name. And Madanji, I will share the title with you from that book. And he has written that book, and he has visited many times, and he presented many Unani facts to us, which we were not aware. And I know all the stories which you were telling, all people were telling about Hakim Ajmal Khan. I can tell everybody on a lighter note. All the serious discussions are going on, and I'm nowhere to participate on these discussions. मदन जी, हिंदी में बोलना ठीक है कि इंग्लिश में ठीक है?
हिंदी में बोल लो जी। हिंदी में बोल लो।
अच्छा, हाँ, मेरी हिंदी बिल्कुल ठीक है, क्योंकि मैं दिल्ली का हूँ, और मैं दिल्ली में पुरानी दिल्ली का हूँ, और पुरानी दिल्ली में चांदनी चौक का हूँ, चांदनी चौक में वकीलपुरी का हूँ, और जहां मैं खेला हूँ वहां हकीम अजमल का वो उसकी मिर्जा गालिब की गली है।
अच्छा,
हाँ, जहां पे हम चाट पकौड़ी खाते हैं, वो सारे क्या कहते हैं, सदर बाजार, फिल्मिस्तान, पहाड़ी धीरज, सब इलाके में बड़ा हुआ हूं मैं, तो मैं अच्छी हिंदी बोल लूंगा, ठीक है। तो हिंदी में बात करें तो ये है कि यूनानी में बहुत स्कोप है, लेकिन समहाउ इंटरनेशनली यूनानी को वो रिकॉग्निशन नहीं मिल पाया जो एक आयुर्वेद को मिला, और मैं तो कहूंगा क्या कहते हैं, शायद 5 या 10% भी नहीं मिल पाया, जो कि ठीक बात नहीं है। और होम्योपैथी ने इतना अच्छा स्थान प्राप्त किया क्योंकि वो जर्मन से शुरू हुआ, इसलिए यूनानी ग्रीक से शुरू हुआ, आयुर्वेद भारत से शुरू हुआ, 6500 साल की हिस्ट्री है। तो यूनानी को भी एक प्लेटफॉर्म पे लाने के लिए, जैसे मैंने देखा आज ईस्ट एशियन कंट्री से काफी लोग हैं, आपने भी तेहरान से ही बताया, और पाकिस्तान, बांग्लादेश से हैं, तो मुझे लगता है कि लंदन एक ऐसी जगह हो सकती है इन फ्यूचर, if you think Madan ji and with all the organizer and all the experts in the Unani medicine, कि फ्यूचर में 2023, 24, 25 कभी भी एक लंदन में एक इंटरनेशनल यूनानी कॉन्फ्रेंस हम ऑर्गेनाइज कर सकते हैं। और उसको कि लंदन में इसलिए मैंने कहा कि वी हैव ए साइजेबल नंबर ऑफ अच्छा मैं दोबारा से हिंदी बोलता हूँ, हमें यहाँ पे ना मतलब काफी पाकिस्तान के काफी लोग हैं, और यूनानी मेडिसिन जैसे मैं अगर यूनानी मेडिसिन किसी को देता हूं तो हालांकि मैं प्रैक्टिस नहीं करता, मेडिसिन कोई देता नहीं, लेकिन प्रिस्क्राइब करता हूं, तो मैं अपने आप को मतलब जैसे मेरे को तुर्किश के लोग आएंगे, मोरक्का से लोग मोरक्कन लोग बहुत हैं, वो आते हैं, तुर्की ओरिजिन के बहुत लोग आते हैं, पाकिस्तान के लोग आते हैं, तो वो पूछते हैं वैद्य, उनको पता नहीं होता वैद्य क्या हूं, क्योंकि मैं आई नेवर यूज डॉक्टर एज टाइटल, मैं वैद्य हूं तो वैद्य ही लिखता हूं। तो वो कहते हैं वैद्य क्या होता है, मैं उनको कहता हूँ हकीम समझो मुझे, आप मुझे हकीम समझो, मैं हकीम हूं। जैसे आपके देशों में हकीम होता है तो बिल्कुल पुराना जो हकीम होता है, दाढ़ी वाले टोपी लगा के ऐसे होते हैं ना हकीम, मैं वो वाला वैद्य हूं, बट थोड़ी सी मैंने ये है कि मैंने शर्ट पहन रखी है, बस इतना फर्क तो मैं उनको ऐसा करके बोलता हूँ, उनको समझ में आता है।
Madan ji, he defined the Hakim, so I don't look like a Hakim. Wasn't my
I mean, these people
Nobody
have
here
the
looks like
impression
that.
these people have
Nobody
the
looks.
impression of the Hakim like that. You know,
But
Hakim-
let me
when
intervene.
you have an article-
We have members in World Unani Foundation. We have members from England. Mohsin Saab knows very well, and we can from World Unani Foundation we can have a conference in London. Nothing doing.
Yes, yes, we will help you.
Mohsin Saab can
Madan ji will
elaborate
help
on that. Mohsin
Madan
Saab can
ji will help
elaborate.
you. I will help you. I will help the organizer to organize some international congress here, and we are here very well placed. And in fact, we are going to create a national center of excellence here. And Prince Charles already is taking very much interest. In 2018, Prime Minister Modi came here, and I'm in the core team, and we are also a group of all party parliamentary group. And Madan ji is also the member in that group. He also comes very often to the parliament, and we can present something very, very good. If you really want to do something great in that aspect. So I think outside India, this will be the destination for taking a big leap of Unani medicine in the whole world. And with those words, I will like to...
Mohsin Saab to
Dr.
be in
Naveen,
touch
as
with
you
you.
were saying, Doctor, as you were saying, Pakistani, na? The Dr. Idris is there. By the way, I get Khamira Gozaban Arshadwala from Pakistan. The taste is same 20 years back what I tasted at Karol Bagh. I get it in Germany from Pakistan, not from India.
अब देखो आप जर्मनी में मैं प्रैक्टिस करता हूँ. I'm in Germany many times. I mean, it was every month I was having a practice in Germany. So Germany में जो आपका रूअफ़ज़ा मिलता है, वो रूअफ़ज़ा का टेस्ट बदला ही नहीं है अभी तक. वो पाकिस्तान से आता है.
No, it is not changed. The Ruafza what we get in Germany. I had to take Ruafza from Germany to India last week.
मैंने देखो
because my mother wanted the old taste of Ruafza. The new Ruafza
पिया है, पाकिस्तान का रूअफ़ज़ा पिया है, तो वो दोनों भाई अगर हो गए.
See, the Ruafza
Basically, we are from same culture. That is why we are from same culture. And Hamdard Ruafza has been established by two brothers, so there is blood relation. There is blood relation between these things.
Yes.
हमारे साथ यूनिस जी हमारे साथ है मोहम्मद आरिफ जी. मोहम्मद जी नमस्ते. I think he's traveling. Mohsin ji, this is a big, ये जो बात जो अब बताया, जो गुप्ता जी ने जो बताया और जो अमीना जी ने जो बताया, this is a big bad thing for Hindustan. We must do something. And you are very
fortunately one of our
you give us the Khamira way.
Fortunately, one of our founder trustees of World Unani Foundation is from Leicester, Hakim Salim Khan. He's running a clinic there in Leicester. So, like Naveen ji has suggested, our organization can go in for a conference there. And as you said, that there are a lot of Pakistani Hakims there. When England was with the EU, they didn't know what to do with the ban on the herbal medicines. They were neither there nor there. So they were allowing the medicines to be imported by a registered herbalist. And all that restriction was that they could not sell it as an OTC product. So still, again, the medicines are being sold, the Unani medicines. I am surprised that he's increasing his range. Every time he orders from me, he's increasing the range of these khamiras and the distillates, archaeats that they say. That means that there is a lot of demand from the Hakims, so he's supplying to the registered practitioners there.
सर आप शरबत दूध सेहा बनाते हैं आप? शरबत दूध सेहा
जी
वो उसको बहुत हमने लोगों को बताया इंडिया में कोरोना के पीरियड में, और उसको मैं कैंसर में भी इस्तेमाल करता था। बहुत ही बहुत फायदे हैं उसके।
So London is a very good market for this.
Arche Macau, Arche Kasni, Absentine Vilaiti, Absentine Rumi, all this.
Arche Gajama.
Arche Gauzaba, it was like, it went up to 200 euros on sale here. So many of the Pakistanis who came at the last flight, they brought only Khamira Gauzaba and Arshadwala.
Amina ji,
she's having some engagements. Dr. Madan,
I just want to interrupt.
Ghazala is leaving.
Ghazala ji wants to leave us. Ghazala ji, thanks from all of us here for your wonderfully detailed.
Thank you, sir. Thank you very much.
And I hope we will stay in touch. I hope you will keep.
Yes, sure, sir. Sure, sir. Sure.
Thanks to.
Thank you. Good night to you all.
Mohsin ji for bringing you to us, and we want to stay in touch. So thank you. Wish you a lovely evening.
Thank you.
Thank you for your wonderful presentation. I want to come back to that one question.
Madan ji, Dr. Idris is there from Pakistan. Idris, unmute. We are talking about Khamira Gauzaban. Today morning I told him, can you please send me some Majune Jawarish from Pakistan?
Yes, I can send you.
Idris,
I am here.
Idris, you are there?
Yes, I am here.
Yeah, he's there.
The floor is yours. We want to hear a few words from you. Thank you for joining us today.
Thank you, sir. It is very pleasure to join you.
Where are you joining us from? Where are you today?
Today I am in Lahore, Pakistan.
Thank you for joining us today. Please, the floor is yours. We want to hear.
Yes, sir. Unani medicine is basically we are, as you said, that the Ruh Afza had blood relation. Then Pakistan and India has also blood relation. That he is the same from Bare Saghir, and after it was a separation. But the Unani medicine and herbal medicine all over the globe, they are populating and they are promoting. We see that the medical science gradually shifted towards the allopathic system and chemical system. And after getting the peak of the synthetic drugs, they are tilted toward the herbs. And now they confess that we are at fault, that chemicals can recover the disease or chemicals can cure the disease, but the nature can do it. I listened to all presentations and it was very beneficial of the Hakim Ajmal Khan. That was the Jushanda that was prescribed in 100 years back. And that Jushanda is still very effective for the different pandemics and different viral diseases. So we think that we are the lucky one that we have never changed our ideology, and we are still at the legacy of our ancestors. So we have to keep attach ourselves, and we have to actually I want to say that in the ancient times, in the time of Hakim Ajmal Khan and in the time of old ancestors, now the science is advanced, and now the time is that we have to say that the Sharbat Tood Siyah has many effects. We have to talk on the scientific reasons that the Sharbat Tood Siyah at the molecular level and at the cellular level has following effects. Arke Gau Zaban has the following effects on the cellular level. Arke Mako has the following effects on the cellular level. we have to prove the efficacy on cellular level and molecular level. This molecule or this the khamira and this javarish, this majun, whatsoever formulation is this, but we have to do more researches on that, and we have to prove that this science and to compete the modern scientific treatment methods, that we are not at the suni sunai baat pe hum nahi chal rahe. We have the scientific evidence behind this medicine. In Pakistan, we call.
आपके अभी your point is very nicely presented. एक सवाल आपसे, कराची में है जी आपके आगा खान यूनिवर्सिटी और मेडिकल स्कूल, शायद पाकिस्तान की, अब उनके साथ आप लोगों के कुछ चल रहा इंटरेक्शन, कुछ चल रहा कि यूनानी वालों के साथ, थोड़ा बताना जी इसके बारे में.
Sir, at this time I am in Superior University Lahore and I am heading the Institute of Eastern Medicine in Superior University, and before this I was as a research specialist in Aga Khan Medical University, and I have served 2 years in Aga Khan Medical University as a research specialist.
Now, what is the level of engagement, Ji? Because it is a very important, very high quality institution, Aga Khan University, Medical University. वहाँ लोगों के मन में ये क्या है जी कि यूनानी वालों के साथ बातचीत करने में?
सर, दो तरह से बातें हैं ना, अगर मैं इसको क्लियर करूं, जब वो चीजों को देखते हैं ना एफिकेसी, मतलब वो ये मानते हैं कि ड्रग्स जो है, यूनानी ड्रग्स जो है, इट इज वेरी इफेक्टिव एंड इट इज वेरी नाइस एंड नो साइड इफेक्ट्स एंड इट इज नेचुरल एंड दैट्स ग्रेट ये वो. बट जब पूरे आगा खान हॉस्पिटल की बात करें तो उसमें एक भी हकीम नहीं बैठा होगा, उसमें एक भी शोबा ईस्टर्न मेडिसिन का या यूनानी मेडिसिन का नहीं है. वहां पे इम्प्लीमेंटेशन करने की जब बात आती है तो वो फिर पीछे हट जाते हैं. ये कोई मतलब
आपने सही से बताया. इसमें हमारी तरफ से एक और क्वेश्चन, एक और सवाल. यूनिस जी है हमारे साथ और बाकी काफी लोग, अग्निहोत्री जी सीनियर पर्सन. तो हमारी तरफ से एक सवाल और जी, ये तकलीफ क्यों है आपके वहाँ पाकिस्तान में? थोड़ा बताना जी, क्या तकलीफ क्या है इनकी?
अब फिर आप सच सच पूछना चाहेंगे?
सच बोलोगे? क्योंकि नवीन जी भी है हमारे साथ. आपने सुना होगा नवीन जी की वो he has knowledge of both the systems. हम कह रहे हैं कि सब कुछ की सारे सिस्टम की नॉलेज होनी चाहिए. आयुर्वेद वालों के जैसे नवीन जी, ही इज प्रैक्टिसिंग, शायद 3 दिन पहले आया पंचकर्मा करके यूरोप में कहीं. तो इस टाइप का कॉम्पिटेंस क्यों नहीं आने? व्हाई इज इट नॉट कमिंग? क्यों? व्हाट इज द तकलीफ क्या है?
सर सिंपल सी बात ये है ना कि जो उन्होंने पिछले 50-100 सालों में इन्वेस्ट किया है, जो एक फार्मा की लेगेसी बनाई है, जो मतलब अगर एग्जांपल हम लें तो डायबिटीज की वो एक ड्रग से शुरू करते हैं मेटफॉर्मिन से, और अगले 3-4 सालों में पेशेंट की 4-5 ड्रग्स और ऐड हो चुकी होती हैं, एक एंटीलिपिड भी ऐड हो चुकी होती है, एक उसकी पीपीआई ऐड हो चुका होता है. और वो जो हमारे एक सर कहा करते थे कि ये फार्मा कंपनी जो है टैक्स वसूल करती रहती है, टैक्स की शक्ल में ना, वो ये समझते हैं कि अगर इनको हम प्रिवेल करेंगे तो हमारी फार्मा इंडस्ट्री क्लोज हो जाएगी. ये तो इस तरह से करते हैं कि मतलब अगर आप लोगों को ये बता देंगे, जैसे आज वो प्रेजेंटेशंस थी कि आप सपिस्तान लें, उनाब लें तो आपका ये एंटीवायरल है, एंटीबैक्टीरियल है, तो फिर डॉक्टर के पास कौन जाएगा? फिर वो इतने महंगे टेस्ट कौन करवाएगा? फिर इतने ट्रीटमेंट्स के लिए किसने जाना है? तो वो अब ये उनको अब अपना जो फार्मा में इतनी इन्वेस्टमेंट हो चुकी है अरबों के हिसाब से, तो वो सारी फिर उनको डूबती नजर आती है. फिर इसके साथ साथ आप दूसरा इफेक्ट भी देखते हैं ना, एक बंदा जो मेडिकल कॉलेज में पढ़ता है, अब आगा खान की आपने बात की, अब आगा खान में एमबीबीएस करना, इसका मतलब ये है कि अपनी सारी जायदाद बेच देना. तो जिसने पूरी जायदाद बेच के एमबीबीएस किया है, अब वो ये चाहेगा कि उसका मरीज जो है वो बहीदाने से या सपिस्तान से या उनाब से ठीक हो जाए और उसको वो कोई लिफ्ट ही ना करवाए. तो मेरे ख्याल में तो ये सच है इसके पीछे कि वो तकलीफ ये है.
चलो इदरीस जी, थैंक यू सो मच. आपने खुला खुला बता दिया बात. Very, very grateful for this. I wanted, before I come to Naveen Gupta ji, I just want a few words from Younis ji. Younis ji is हंस रहा है सुन के कि ये हाल चल रहा है.
Basically, these mafias are everywhere. I can't say that it is only in Pakistan. It is everywhere. Even I have seen. I have learned that even in FDA, all the companies have those who are FDA members. They are paid by the companies. It is not only in India or Pakistan. It is in European countries also. So this is a mafia which is going on. The patient. जब भी पेशेंट हमारे पास आता है वो सिर्फ ये कहता है कि मैं ठीक हो जाऊं क्या. वो नहीं ये पूछता है कि इसकी टॉक्सिसिटी हुई है, वो ये नहीं पूछता है कि इसकी मॉलिक्यूलर स्टडीज हुई है. वो सिंपली ये चाहता है कि मैं ठीक हो जाऊं. इट इज ओनली दोज पीपल who are not totally associated with the patient. They only demand that where is toxicity. I had a discussion with he was the vice chancellor of Kashmir University. In those days he was a professor in biotechnology. वो हार्वर्ड से रिटर्न थे डॉक्टर खुर्शीद, प्रोफेसर खुर्शीद अंद्राबी. जब मेरी उसके साथ डिस्कशन, उसने सिर्फ यही पॉइंट उठाया कि प्लांट्स की टॉक्सिसिटी टॉक्सिकल स्टडीज नहीं हुई है. मैंने उसको सिंपली ये कहा कि आप जर्नल नहीं पढ़ रहे हो. Though you are from Harvard, but you are not reading the journals. You should read journal. Every plant has now been evaluated for the toxical studies. तो बाद में मैंने उसको लास्ट में यही कहा, you might be master in your subject, but I am master in my subject. You can't compete me in that. तो लास्टली ये हुआ कि फिर मेरी कॉन्फ्रेंस हुई 2015 में, जिसमें मोहसिन साहब की वर्ल्ड यूनानी फाउंडेशन भी एसोसिएट थी. हमने उसी को चीफ गेस्ट लाया इस बेस पे कि ही विल रिवाइव जो 1977 में यूनानी फैकल्टी यूनिवर्सिटी में सस्पेंड हुई थी. ही विल रिवाइव दैट, एंड फॉर्चुनेटली ही वाज काइंड एनफ टू अस कि आफ्टर 3 months he revived the Unani faculty. He appointed the dean Unani faculty, and that is running this time in the Kashmir University. So it is the approach. आप किस तरह से अप्रोच करेंगे, how you will discuss with the people, that matters.
यूनिस जी, लगता है हमारी तरफ से वो आगा खान यूनिवर्सिटी के साथ थोड़ा सा बातचीत होनी है. थोड़ा
let us have one conference of World Unani Foundation in Aga Khan University. Then we will say to them that what we are doing.
First, let us do a benchmark for Unani training for India. Unani students in India, first let us make a benchmark.
Thank you.
Let us bring the whole of Unani in India from north to south, east to west, because India itself is a subcontinent. If we can, that is what I'm requesting, Mohsin bhai, from your World Unani Foundation, if the entire, instead of going out of India, in India itself, if we have one module of Unani training, because when you go to Chennai, there is different. When you go to Bangalore, there is different. When you go to Bombay, there is different. So it is again like racism. The North Indian Unani from Aligarh and Delhi, they think they are superior, and the South Indians don't know anything because they don't know Urdu. So if we, instead of going for foreign languages, if we can have modules in Unani within India itself, Marathi, Kannada, Tamil, Telugu, Malayalam, we have 24 Indian languages. At least a document what is Unani medicine for Indians.
Thank you. I mean, simple. I think Professor Agnihotri ji is recognizing your comment. He will come back at some point. He will give his thoughts about this. I want to see if this is a wonderful discussion today. Naveen ji, last word from you before we transfer the platform to Pawan ji.
I think there are सब लोग इतने विद्वान लोग हैं, और मैं तो यूनानी के बारे में क्या बोलूंगा, क्योंकि मैंने वो फिलॉसफी जो है वो केवल अपने दोस्तों से सुनी है. केवल दवाइयों का इस्तेमाल कर लेना और कह देना कि उससे ठीक हो जाता है, मैं उसमें बिलीव कम करता हूँ. मैं चाहता हूँ कि इसको, जैसे अभी इदरीस बता रहे थे, उनकी मॉलिक्यूलर और सेलुलर लेवल पे कैसे काम करता है. हमारे यहाँ स्रोतस है, आयुर्वेद में चैनल्स हैं, चैनल सर्कुलेशन है. अगर हम उसको स्रोतस के लेवल पे ले जाते हैं यूनानी मेडिसिन को, कि किस स्रोतस पे किस प्रकार से स्रोतो विशोधन करती है, किस प्रकार से स्रोतो संघ को रिमूव करती है, ब्लॉकेज इन दी चैनल्स को, अगर हम उस ढंग से इथियोपैथोजेनेसिस को पढ़ते हैं, समझते हैं, और रिवर्सल ऑफ इथियोपैथोजेनेसिस, दैट इज द बेसिक, this is the basis of the medicine, that you reverse. And for reversing the pathology to physiology, we have to come across several concepts which I do not know about Unani medicine. There are so many experts because we know about Ayurveda, we know this Siddhant of Agni, Dosh, Dhatu, but I do not know how does our Unani system of medicine works in that sense. So I'll not be able to comment much on that, sir.
Now,
I will be able to experience only some medicines which we used, but all the experts are there. They are in better position than me. But Hakim Ajmal Khan was the inaugurator of our college. 1921, the idea was that Mahatma Gandhi and Hakim Ajmal Khan, they will come together, because you have to understand, Madanji and all other people, dignitaries, that there was a conflict going on between the two religions in India. And to come to one point where everybody, I mean, the religions of Hindu and Muslim should not fight with each other, that the idea was framed to start a college together. And this is how our college came into existence, by Mahatma Gandhi and Hakim Ajmal Khan. And even the road in which my college is situated, that road is called Hakim Ajmal Khan Road. And it is, Madanji, it is one of the most expensive road in Delhi. To buy a shop at Hakim Ajmal Khan Road means you can buy a full street in Lahore. That's the cost of that shop. So that's what legacy of these people are in India now. So
that legacy is to be taken forward. Let us keep science. Let us keep academic secular, pure secular, not restricted with exactly. When disease is secular. Disease doesn't see which religion he belongs. Why should medicine be a communal type? Let it be secular.
अभी वो एक किस्सा सुनाता हूँ, आपको सबको अच्छा लगेगा. तो हमारे कॉलेज में बड़ा कहा जाता था, हकीम अजमर खां 500 रुपए फीस लेते थे उस समय नब्ज देखने के लिए. तो उन्होंने नब्ज देखी एक पेशेंट की, तो उन्होंने बताया कि आप ना अनार का छिलका पानी से पी लो, और वो मरीज ठीक हो गया. अब 500 रुपए दिए, ठीक हो गया. 500 रुपए तो पता ही आपको कितने थे आज के जमाने में. आज तो वो क्या कहते हैं, पता नहीं कितने यूरो, कितने पाउंड्स के बराबर होंगे. एनीवे, तो उसके बाद उसी फैमिली में, बहुत अमीर फैमिली थी वो, कोई दोबारा कोई बीमार हो गया, वही सेम लक्षण थे उसको. उसने कहा हकीम के पास क्या जाना, 500 रुपए खर्च हो जाएंगे बेकार बात में, अनार का छिलका ट्राई कर लेते हैं, आप अनार का छिलका पानी से दे दो. वो ठीक नहीं हुआ, तो उनको आखिर में जाना पड़ा हकीम के पास. हकीम ने नब्ज देखी तो कहने लगा हमने तो अनार का छिलका इसको खिला दिया जी. उन्होंने कहा अब की बार तुम एक काम करना, अनार का छिलका गर्म पानी से देना. उन्हें गर्म पानी से दिया, पेशेंट ठीक हो गया. और ठंडे पानी से देते रहे, पेशेंट ठीक नहीं हुआ. तो 500 रुपए गर्म पानी के ले लिए उन्होंने बस खाली, और पेशेंट ठीक हो गया.
नवीन जी, दिस इज कॉल्ड हिकमत.
दिस इज कॉल्ड
हिकमत.
This is called हिकमत. अनार का छिलका लेना है, आपको अनार का छिलका ही लेना है, ऐसे लेना, पैसे से लेता, अब गर्म पानी से ले लेना इसको बस खाली. उसने गर्म पानी से लिया, ठीक हो गया वो.
You're all speaking about Karol Bagh, na? The actual meaning of Karol is green chili, bent green chili. So you know how the name came. Just go back and look into the history. There is a Mohsin bhai, we picked up the book from the street from Chandni Chowk. Karol Bagh, the main Karol means bent green chili.
Oh, that I
टेढ़ी मिर्ची है. तो टेढ़ी मिर्ची दोनों ने मिलके कहा कि हम यहाँ पे दवा करना शुरू करेंगे, because Haiza had started. So it was the fiery place. That is only for Haiza, only for epidemic. There was a tent put on, and then the Pakistani and Indian Haiza was started there.
ये इतना हिस्ट्री मुझे पता. थैंक यू वेरी मच फॉर टेलिंग मी दैट.
We booked, how much? I think I picked up free. वो तो इतनी बड़ी गड्डियां.
अभी हमारे कॉलेज में जब हम कॉलेज से फिनिश करके आए 83 में, अभी भी एक एम्बुलेंस पड़ी थी. एक एम्बुलेंस थी जो बहुत पुरानी हालत में उन्होंने रखी हुई है, उसको संभाल के.
अभी भी है वो पुरानी टूटी हुई कुर्सी भी है, अभी भी
कुर्सी भी है. और इतनी हमारे डायरेक्टर के रूम में पड़ी है वो कुर्सी, इतने लंबा उसका वो, मतलब उसकी हाइट जो पीछे तो अभी भी वो डायरेक्टर के रूम में पड़ी हुई है, जो उस समय इस्तेमाल होती थी.
Naveenji, I'm so happy.
Karol Bagh. So he showed me this is Hakim Ajmal Khan's chair. I said, should I jump and sit on that?
Naveenji, I'm
Thank
so
you, Madanji,
happy
for all
you have
this.
joined us today. Old students are the most precious thing. Agnihotri ji is here, old student of Banaras in the university, and these old students, and maintaining that parampara is so important. So you are a lucky very fortunate person, and we are very fortunate to have you here from London today, and very fortunate that you have shared a very important idea कि लंदन में करेंगे जी एक. अब इदरिस जी भी आएंगे, अब मोहसिन जी भी ले आएंगे लोग. अब we will work on this जी.
Arman can also come. Idris can also come. No problem of visa for London.
और हमारी बामरा जी है, All Party Parliamentary Group, उसमें यूनानी भी है. We will bring everything together. So thank you for joining us today. Hakim, Rahul ji bhi aayenge Bangladesh se. So before I return the platform to Pawan ji, I just want if there is anybody else who would like to share a few words. I can see many more people here with us. We are still a large number of people here with us. If there is anybody else who would like to share some thoughts, please raise your hand or just come to the floor.
Let us have some points from Agnihotri ji, please.
Acha. And Agnihotri ji, this is before your closing comments, क्योंकि पवन जी के पास जाके फिर आपके पास आएंगे, तो आपकी तरफ से थोड़ा सा.
बहुत शुक्रिया मदन सर जी. और जैसा कि पवन जी ने बताया स्टार्टिंग में ही, आज का दिन तो हमारे यूनिस मुंशी जी का रहा और उनकी ही बदौलत और मोहसिन देहलवी जी की बदौलत आज हमारे सब इतने मेहमान लोग इकट्ठे हो सके. और मैं इतनी देर से सुन रहा हूँ, बहुत सारी यूनानी आयुर्वेदिक सूचनाएं मिली, एकेडमिक सूचनाएं मिली, ऑन द रिकॉर्ड मिली और ऑफ द रिकॉर्ड मिली. और हमारी मैडम अमन जी ने तो बहुत ही ज्यादा पूरा अमन चैन ही बनाए रखा. स्पेशली करोल माने टेढ़ी मिर्च, ये तो सबके ही ज्ञान के दरवाजे खुल गए होंगे कि करोल शब्द कहाँ से आया. देखिए, जो चर्चाएं हुई आज, हमारे सारे अच्छे चर्चाएं हुई और नवीन जी ने भी बहुत अच्छी बातें रखी, क्योंकि वो आयुर्वेद से हैं. कहना ये कि आज की तारीख में पाकिस्तान से, हमारे कराची से साहब बोल रहे थे, कहने लगे कि अब हमें ये समझाना होगा कि खमीरा गाजवा या रुआवजा या कोई भी भस्म कोई भी कैसे काम करती है. और तुरंत ही उदाहरण मिल गया हिकमत का, गर्म पानी और ठंडा पानी. तो हमारे पास दो पक्ष होने चाहिए. एक तो ये कि औषधि है, मेडिसिन है, काम करती है, रिजल्ट दिया, चाहे वो संजीवनी बट्टी हो चाहे गाजवा हो, काम किया, ये तो मान ही लीजिए. अब वो साइंटिफिकली कैसे काम करता है और उसको हम डॉक्यूमेंटेशन करें, उसका हम एक्सपेरिमेंटेशन करके प्रूफ करें, तो दिस इज सीधा रिवैलिडेशन होता है. संजीवनी बट्टी ने बुखार उतारा, संजीवनी बट्टी ठीक हो गई. ऐसे ही हमारी यूनानी औषधियां हैं. तो दोनों चीजों को मिक्स क्यों करें? क्योंकि उस जमाने में शोध कार्य का संसाधन नहीं था, तो अलग बात है. आज भी जैसे उन्होंने बात उठाई कि आगा खान यूनिवर्सिटी में इतना बड़ा अस्पताल है लेकिन यूनानी का नाम लेने की स्थिति नहीं है, तो उसके बहुत से लोकल रीजन हो सकते हैं. लेकिन जो चीजें रखी हैं, खासतौर से हमारी गजाला मैडम ने बहुत ही अच्छे से लिटरेरी सारी बातें बताई, जो औषधियां काम करती हैं वो यूनानी से बताई. कारण क्या है? आपने बताया कि मैडम ने ये बात बहुत बढ़िया की, पहले हम इंडिया में इकट्ठे हो ले. 24 भाषाओं में बिखरा हुआ हमारा भारत है, इसमें कितना यूनानी है. मैं अपने उत्तराखंड में देख पा रहा हूँ, भारत में कितने स्टेट है जहाँ एक भी यूनानी कॉलेज नहीं है. उत्तराखंड 2000 में बना है और इसमें एकमात्र यूनानी कॉलेज है, वो भी प्राइवेट है, पदार्था में इकलौता कॉलेज है. और उसकी भी अभी क्योंकि डेवलपिंग है, शायद पहला बैच निकलने को शायद निकल गया हो, तो ये स्थिति बड़ी गंभीर है. अच्छा, फिर इसी वजह से यूनानी औषधियां बहुत मिलती नहीं. केवल हमदर्द दवाखाना में है, वो भी और भी सारी औषधियां रखते हैं जो उनका सेल बढ़े. दुकान खोलने के साथ साथ आदमी को रोटी भी तो कमानी है. 20 आइटम लेकर रख लिया और डिमांड ना आई तो ब्लॉक हो जाती है. ये मुश्किल है. यूनानी वैद्य होगा तभी यूनानी औषधि लिखेगा. तो ये बहुत सारी चीजें जो कि चैनलाइज होनी है. मैं समझता हूँ आज की जो डिस्कशन आया है उसमें ये बात जरूर रखनी चाहिए. जब हम यहाँ पहले यूनाइट हो जाएं, उसके बाद हम नटशेल में कह सके, हाँ भाई ये मेरी 50 चीजें हैं, ये 100 साल से काम कर रही हैं, आगे 1000 साल तक काम करती रहेंगी. बस इनकी गुणवत्ता, पवित्रता बनी रहे, इनके रॉ मटेरियल मिलते रहे. क्योंकि अजमल खान साहब का बताया, उनको तो बहुत बड़ी श्रद्धांजलि हम सब लोगों को है. 1868 में वो पैदा हुए, 1869 में महात्मा गांधी जी पैदा हुए. तो ये लोग कॉन्टेम्पररी है, समकालीन है. और इन्होंने उस समय देश में, भारत में और ब्रिटिश शासित भारत में क्या तीमारदारी की व्यवस्था थी, क्या हिकमत था, क्या आयुर्वेद था, इसको जिंदा रखने के लिए जो चीजें सामने लाई, इसमें अजमल खान साहब का बहुत बड़ा योगदान रहा. उन्होंने तिब्बिया कॉलेज बना के और ये व्यवस्था रखी कि आयुर्वेद भी जिंदा रहे, यूनानी भी और फले फूले। और यूनानी और तिब्बी हम समझते एक ही केवल स्थान का परिवर्तन है कि वहां से आया, इसलिए नाम बदलते हैं। कि हमारे यहाँ तो उत्तर प्रदेश में लखनऊ में आयुर्वेद, यूनानी एवं तिब्बी बोर्ड ऐसे मानते रहे हैं। तो ये बड़े अच्छे विचार आ जाए हैं। ज्ञान भी बना रहे, गुणवत्ता भी बनी रहे, इसका एकेडमिक फील्ड भी बना रहे, इसका जो मेडिसिनल पक्ष है वो भी बना रहे, और साथ साथ हमारा एसोसिएशन के आधार पर हम इसके विकास के लिए माने नेशनल और इंटरनेशनल लेवल पर यूनिवर्सिटी भी बनाए, तो बहुत ही सुखद अनुभूति होगी। थैंक यू सर।
Thank you, Ji. I want one, Agnihotri Ji, thank you so much. You have touched some very, very deep and sentimental and very important points. Thank you so much. आपने उत्तराखंड की बात जो बताया कि that is a unfortunate issue, but I think we have wonderful people here with us who are also passionate about Ayurveda. I want to thank Amina Ji, Karol Bagh ki baat. Amina Ji, thank you so much for sharing this. Or you have enlightened us completely today. Ki kyun? Why is it called Karol Bagh? So you have given us the history, and we are very grateful you have joined us today from Germany. And I also know that Amina Ji ki contacts, she has a lot of contacts in Turkey. She has a lot of contacts in many other parts of the world. So please stay with us, Amina Ji, in the future programs.
It was 1 year, you sent me the Zoom link and asked me to join.
Yes,
it's 1 year exactly that we spoke.
We will have a special program. I want to take one or two final words. Idris and Idris Ji, aapki taraf se thoda. Idris Ji.
Yeah. India and Pakistan.
जी सर.
हाँ जी, आपसे एक दो शब्द और लेके फिर we are trying to close this program. Thank you for joining us from Pakistan.
Sir, first of all, I would like to thanks to all the organizers for organizing such a beautiful meeting. And I think this is the what we can do for the Unani system of medicine, that we have to promote it. And I think the word I can use, that we have to preach about it for the well-being of humanity, and for the promotion of the health system, and for the betterment of the ill community. I think I have to use the word jihad. If
no.
What we are doing, actually the word jihad means that
I will
something.
not love you again in this meeting from India.
Basically, translation of jihad is struggle.
Yes.
For anything.
Struggle for a good thing. Struggle for a good thing is called jihad. So we have to do the jihad to prevail this system of medicine around the globe.
Thank you.
Madanji, I should thank Idris. He was on the way. So whenever we have a Zoom meeting and Idris is there, his daughter, she unmutes and she says only hello to me, and she goes.
Ji, thank you.
Thank you, Idris. Like, he came home, and there is also the electricity and also the data problem of internet, same as in India, the Pakistan also. And thank you, Idris, for using the data to join, and also the battery.
Thank you so much, Amina Ji, for bringing so many wonderful people here. Also,
I think Mohsin Bhai will accept with me that if it was not Madan Ji, then we wouldn't have been able to pull the strings between Ayurveda and Unani. Well, so Madan Ji, somewhere you are like the bridge with it for the integration within the systems in India. So we are thinking of integration. Integration not only between Ayurveda and Unani, integration between Unani. This is what I'm asking Mohsin Bhai today. Mohsin Bhai, we need integration within Unani, integration between South and North and East and West, within Delhi and Lucknow and Aligarh, which is, I don't know if it is possible or how it is. Because if we don't integrate, even integration within the streams, like integration between ophthalmology and gynecology, Unani ophthalmology and Unani gynecology, within the medical systems, within itself. And so its integration is not only allopathy and Unani, or allopathy and Ayurveda and Unani, within the system. So Madanji, somewhere you are that bridge. I'm a bit way ahead of all this because of the genomics. Finally, when I look into the genomics, finally, when I look into the mutations and, you know, backlog, my first article, which it came in German in Thema publication, what is the similarities and what is the differences between the traditional Unani system and the traditional European medicine? So when it is originated from Greece, it's taken a lot of things. Triphala comes from India. Kushta comes from India. So that is a traditional Indian medicine into the system of medicine, which is Unani medicine, which always Mohsin Bhai and I discussed regarding the herbs and everything. Madanji, if you and, you know, Mohsin Dehlvi from his foundation and all of you, I mean, I don't know much about the person who organized like Independent Research Ethics. He did not change the name. So please, I don't know. I'm sorry. All of you, if you can modulate something, you know, when you can compare Mizaj and genomics, this is what Ajmal Khan did with Ajmalin. He had a vision of genomics, food genomics. That is how Ajmalin came into force. So somewhere we lost because of the politics and because we are just trying to refigure ourselves. Instead of refiguring ourselves, if we can find the bridge, that is where Madanji, because you are a food scientist. And without pharma industry, none of the practitioners can come forward. And Mohsin Bhai, you are the representative of the pharma industry, the food genomics and the pharma industry together to bring in a modulation. So probably, maybe that was a message I could give. Last minute, Madanji, if you pull me, I don't know anything. I'm sitting here.
Last minute, I will request to all the organizers that keep me in touch when you arrange such kind of meetings and such kind of events. I would like to join you, all of you, and I can do anything for the system and for the promotion. I will be there.
Thank you. Idrishi, thank you so much. I think
Idris, please share your email ID, please.
Now I would like to request you all
Idris,
allow me to introduce Independent Research Ethics Society.
Yeah, finally I'm seeing bread. I'm so happy to see bread.
That's why. Myself, Dr. Pawan Kumar Sharma, Vice President R&D and Quality Control, as well as Medico Marketing. Imami Jhandu. Jhandu is the brand of Ayurveda. To negate the negativity of Corona pandemic, we started this journey from 23 April after lockdown from 23 March. So now we have reached to 316. Previously, we conducted webinars on Corona, COVID-19. Then we shifted ourselves to all disorders by experts. And then a new concept was implemented to celebrate every day with different topics with multidimensional experts on different day. Because in modern system, every day is being celebrated by 10 or 15 names. And we are searching for those names which can be related to our Ayush system. And I would like to request you all, this month, only this month, has been lacking with Unani experts. So this platform, Ayush, is not complete without you. So I again want to request Munshi ji and Mohsin ji and all request all Unani expert to recommend me as per my every month's plan. Please recommend speakers from Unani. I would like to involve humbly the expert from Unani in each and every webinar. And one international expert from each and every webinar. This journey is not short. This is infinite journey, indefinite journey, complete journey, holistic journey, brainstorming and educational journey without any logo of any private organization for profitable purpose. So our society is non-profitable organization on which platform we have started now International Interdisciplinary Institute for Research, Education and Skills, which is absolutely meant to train the person for GMP, GCP, GLP, GDP, whichever is required for upgradation of an executive to industry, institute, or academy. This is my humble submission regarding independent
Dr.
research
Pawan,
society.
Dr. Pawan, Idris has a very good presentation on autoimmune disorders. Idris, I have your email ID. I will give you a list of speakers with the topics. They are perfect in India, outside India, what I have. So you can just, I will copy it to you.
Thank you in anticipation.
And you will get it. And second,
Thanks,
I'm
madam.
looking at
This will
banana
be your
bread.
blessing to the munch.
No, nothing. I'm looking at banana bread. So that Madanji doesn't call me all of a sudden and I lose my child. I'm seeing banana
That is
bread.
banana bread
Madanji.
day. How can I incorporate only one webinar on banana? So fruit nutrition is the topic. And then
you can have a webinar only on banana, even banana peel. The tea from the banana peel is high in magnesium to sleep.
on 24th, somewhere in Russia, women revolved there, revolution of women. That is not Women Day in our India, but that was a revolution from women in Russia. So we are celebrating treatment for infertility, where all experts will guide us on the treatment of infertility and so on. So please join, please bless this platform with the expertise, with the experience, with the dignitaries. Definitely, I would like to request you all to support this journey. Madan sir is supporting us well. Excellent. He is our mentor also. And really, you said rightly, he is the bridge between all world to us. Welcome. 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 So I would like, can I request now Professor Vicky Agnihotri ji for
Hello. Namaskar. I thank Dr. Pawan Sharma ji for inviting me for the concluding remarks. It was a great day today as far as the Unani system of medicine is concerned. The full webinar is dedicated for the cause of Unani, and really it's our pleasure and it's our other achievement. As we all remembered today, Hakim Ajmal Khan Sahab, for whom's name this Unani Day is being celebrated every year. So, सबसे ज़्यादा प्रभावित किया उनके जो contribution में, apart from academic and administrative establishment of colleges, etc., was the decoction Rushanda, जो उन्होंने उस वर्ष की जो उन्होंने जो पेंडेमिक स्प्रेड आउट हुई थी उसके लिए दिया, और जिसने बहुत ही अच्छे रिजल्ट दिए, और ये ही उनकी हिकमत थी, यही उनका अपने पद्धति पर, अपनी चिकित्सा पद्धति पर होल्ड था, कमांड था और ट्रस्ट था। उस विश्वास के बदौलत उस समय की सब गरीब जनता और वो जनता जो के पास कीमती न तो औषधियां ले सकती है, न कीमती औषधियां थी उस समय ये था कि जो मिल जाए वो ठीक है, और हकीम जी के हाथ से दिया जा रहा है, हकीम जी ने रिकमेंड किया है तो फायदा तो होगा ही होगा। जैसे कि पिछला आया था विचार की अनार का छिलका ठंडे पानी से, फिर अनार का छिलका गर्म पानी से, वो तो खैर एक उनकी हिकमत हुई और उसमें तो पैसा भी था, ये तो निःशुल्क वितरण में रहा। और तब से लेके आज तक जितनी हमारी चिकित्सा पद्धतियां, विशेष रूप से आयुर्वेदिक है, यूनानी है, सिद्धा है, इन सब लोगों ने भी इस वर्ष के पैंडेमिक में अपनी उन्हीं सब विभिन्न औषधियों और घटक द्रव्यों की सहायता से जो जुशांदा या काढ़ा का तैयार किया, और गवर्नमेंट ने अलग अलग स्टेट लेवल पर भी अपने अपने विभाग के द्वारा निःशुल्क बंटवाया, उसने बहुत बड़ी मानवता की सेवा की। मैं तो कहूंगा कि WHO ने बहुत बाद में निर्णय लिया, जिसके तहत हमारा आयुष विभाग ने हम लोगों को ये अनुमति दी कि हम भी आगे बढ़े। फिर आयुष विभाग ने भी प्रोटोकॉल निकाला, वो ICMR, WHO और सभी ने स्वीकार किया। तो पहले ही काम जो है कि हमारे पास जो भी हिकमत है, जिस किसी पद्धति से हम पढ़े हुए और आज की तारीख में हकीम, वैद्य या चिकित्सक बने हैं, तो सफरिंग ह्यूमैनिटी की, जनता की सेवा कर सके, यही आज के पूरी वेबिनार के साथ संदेश जाना चाहिए। और हम बात करते हैं हमारे जो सबसे पहले हकीम साहब ने हमको इनॉग्रेशन दिया और साथ साथ अपनी पूरी टीम को इंट्रोड्यूस कराया, हमारे हकीम जी यूनिस मुंशी जी से लेके और हमारे मोहसिन देहलवी जी ने, इन दोनों का सक्रिय सहयोग आज न होता तो हमें इतने इतने विचार, इतने पहुंचे हुए जो यूनानी के क्षेत्र के हमारे चिकित्सक हैं, अधिकारी हैं, इनके लाभ न मिल पाते। तो बहुत ही अच्छी चर्चा रही। हकीम मोहम्मद खालिद साहब ने अपनी बातें रखी और उन्होंने बताया कि एक रोड मैप बनना चाहिए, हमें, हम चले कहाँ से हैं, हमें जाना कहाँ तक है, उसमें हमारी यूनानी चिकित्सा पद्धति को हम कैसे साथ लेके बढ़ावा दे सकें, जिससे कि वो राज्य स्तर पर, राष्ट्र स्तर पर और अंतर्राष्ट्रीय स्तर पर अपना जो प्रतिभा तो है, क्वालिटी है, योग्यता है, लेकिन उसको प्रचार प्रसार और उसको बढ़ावा नहीं मिल पाया है, वो स्प्रेड नहीं हो पाई है जो इतने वर्षों में हो सकती थी, क्योंकि उसमें भी सारी औषधियां अच्छी हैं। कुछ एक दवाखाना जैसे हमदर्द वाले मैन्युफैक्चरर भी बहुत कम है, तो चीज जरूरी है। एक चीज जो हमारी मैडम गजाला साहब बोल रही थी, उसमें हमें उनसे तो प्रश्न नहीं किया है, हम जनरल बात कमेंट कर रहे हैं। जैसे उन्होंने ये बताया कि इतना माशा दे के हम ये काढ़ा देते हैं या इतना करते हैं, तो मैं जानना चाहूंगा कि आज के इस युग में अब एमकेएस सिस्टम में है, जैसे कि हम लोगों ने एक रत्ती को 125 मिलीग्राम मान लिया है, तो एक माशा हम 12 माने ये एक तोला 12 से 16 ml या ग्राम ले लेते हैं, तो क्या उसमें कन्वर्जन आज की तारीख में जब वो प्रैक्टिस कर रहे हैं हमारे यूनानी चिकित्सक लोग, वो कर रहे हैं या पुरानी, क्योंकि उसमें डिस्पेंसिंग बहुत मुश्किल है। मेरी सोच केवल इतनी है, क्योंकि आप लोग जर्मनी में भी हैं, कराची में, लाहौर में, बांग्लादेश में, लंदन में, सभी जगह है, तो वहाँ नेचुरली जो इंटरनेशनल सिस्टम है हमारा मेजरमेंट का, वही शायद एक्सेप्ट हो रहा होगा। तो इसे हम लोगों ने आयुर्वेद तो कर लिया है रत्ती, तोला माशा रत्ती को, तो शायद यूनानी में भी इफेक्टिव हो गया होगा। लेकिन आज हमारे बहुत नए हमारे जो गेस्ट जुड़े हैं, मैंने बताया ना, तेहरान से, कराची से हमारे इदरीस साहब हो गए, और उन सबके योगदान आज के लिए बड़ा मेमोरियल रहेंगे, बहुत यादगार रहेंगे। और हमारे मैडम अमीना जी ने बहुत ही अच्छे से बतलाया, और साथ साथ खालिद जी के बीच में ये हमारे मदन सर की खूबी है कि वो जिसको भी प्लेटफॉर्म पर देख लेते हैं कि वो हैं, तो उनके विचार करंटली वो मिलने चाहिए। और यही वजह कि आज की बहुत ही वाइटल रही हमारी वेबिनार, इसमें बीच बीच में अच्छे विचार मिलते रहे। नवीन जी ने बहुत ही अच्छी बातें रखी कि देखिए PUMS और BMS साथ साथ पढ़ के उन्होंने जो निकले, आज लंदन में जमे हुए हैं, प्रैक्टिस कर रहे हैं। मुझे सोच है, चिंता है कि इन लोग कितनी औषधियां यूनानी आयुर्वेद की भारत से या किसी भी कंट्री से मिल पा रही होंगी, और सब लोग बहुत ही भूखे बुभुक्षित बैठे हुए हैं, मुआवजा मंगा रहे हैं, और ये दूसरी गाजमा, खमीरा मरवादीद, ये जितनी कुश्ता है, जितनी चीजें मंगा रहे हैं, जो इंटरनेशनली मंगा रहे हैं, तो इनके उत्पादन का भी आप लोग अपना थोड़ा सा प्रचार करें, प्रयास करें, जिससे कि जनता को और आसानी से हो सके। इसमें गुणवत्ता है, अगर औषधियां सहज सुलभ हो जाएंगी तो मैं निश्चित रूप से कहता हूँ यूनानी चिकित्सा पद्धति की औषधियों को भी बढ़ावा मिलेगा, चिकित्सकों को भी बढ़ावा मिलेगा, शिक्षण को भी बढ़ावा मिलेगा, और भविष्य जैसे हम सब लोग चिंतित, मदन सर चिंतित हैं, कहीं न कहीं विश्व में यूनानी विश्वविद्यालय बने, और क्यों ना इसकी शुरुआत भारत से ही हो। हम लोग तो इसके लिए हमेशा पक्षधर रहेंगे। आप सबका बहुत बहुत धन्यवाद। मैं सबका नाम लेकर तो नहीं कह पा रहा हूँ, लेकिन सभी आज के हमारे मेहमानों ने बहुत ही अच्छे से अपनी वार्ता रखी, और आज मुझे लगा कि आज यूनानी को फिर से जिंदा कर दिया। इस प्लेटफॉर्म को, यूनानी को हमने गतिमान देखा, इसमें काइनेटिज्म दिखाई पड़ा, और बहुत ही अच्छी बात, वो पुरानी करोल बाग से लेके और इसमें जर्मनी तक पहुंची, और मुझे क्या चाहिए, पूरे विश्व में फैल गया। तो आप सबका बहुत बहुत शुक्रिया, बहुत बहुत धन्यवाद।
Madan, he will send me a message. He said, join now immediately.
Naturally, we have to join, or because of your presence, things became so vital and so interesting. बहुत ही मजा, आज बहुत ही अच्छा लगा।
Dr. Agnihotri is watching.
नहीं, आप इतने हंसे, बच्चों की आवाज भी आ गई, आपका कप भी आ गया बनाना वाला, और हम लोग यहाँ बैठे दूर से देखते रह गए।
ये मैं पी रही हूँ बनाना टी, मुझे भूख लग रही है, मुझे अकेले ही खाना बनाना है। मदन जी
ये तो आप डॉक्टर पवन जी से पूछिए, उन्हें कैसी भूख लगती है, 8:30 9 के बीच उनको खाना ना मिले।
सब लोग पता है म्यूट कर देते हैं, मैं नहीं करती हूँ, मैं जो खाना है
म्यूट मत करिए, वीडियो ऑफ कर लिया करिए, फिर आप खूब खाइए पीजिए।
मैं कुछ भी नहीं।
हमारे आज के जो गेस्ट आए हुए हैं, जिनमें हमारे विष्णु शर्मा जी गुवाहाटी से हैं, और हमारे गजाला साहब हो गए, डोमा साहब हो गए, यूनिस मुंशी साहब हो गए, और मोहसिन सर हो गए, और राहुल अमीन जी होगा, सभी लोगों को बहुत बहुत शुक्रिया आपके सहयोग के लिए, आपके योगदान के लिए बहुत बहुत शुक्रिया।
बहुत बहुत धन्यवाद। सिटिंग साइलेंटली आपका गुड मार्क अभी बोले अमीना काम लगाती हो, काम लगाती।
So thank you all, thank you very much. Good night to all. I don't know
banana bread. I'm looking at banana bread.
tomorrow, definitely tomorrow. I will welcome you.
No, Madan ji, he's going to post courier karna hai, DHL. See, no, I make banana bread here.
So virtually some system should be there to share on the webinar.
What? I put amla today in my bread to bake amla and methi. I put it in the bread.
अब आप ललचाइए मत, बना सब कुछ रहे और दूर बैठे लोग केवल उनको लालच दे रहे हैं, इससे क्या फायदा?
बस फोटो भेजूंगी, दिखाऊंगी फोटो का।
और क्रेजी हो जाएंगे।
उसको ना आमला और मेथी की जो मैं इंडिया से एक हफ्ते पहले लेके आई थी, ब्रेड बनाया।
हमारा आवाज कट गया, पता नहीं क्या हो रहा।
आप आ गए वापस, कहाँ गए आप? आ जाइए वापस, ये वर्चुअल है। डॉक्टर पवन, घर से मैं ले आई थी आमला एंड मेथी, तो उसको मैंने डो में बनाया, बैक ओवन में रखा क्योंकि सुबह से मेरा कॉन्फ्रेंस चल रहा था, तो वहां पे बेक हो गया। नाउ आई विल ईट माय एग में बनाना ब्रेड हियर।
आपको जर्मनी मिल जाता है आंवला और ये मेथी वगैरह सब?
आई वाज लास्ट वीक इन इंडिया, तो जब मैं वापस आई तो आंवला और मेथी लेके आई। अभी उसको तो कुछ तो करना है ना, उसका कुछ तो करना है, इसीलिए।
नहीं, यहाँ तो सीजन, यहाँ तो इंडिया में सीजन चल रहा है ना, आंवला का भी, मेथी का भी, बथुआ का, पालक का, गाजर का, सभी इसमें।
इंडिया में इतना भरपूर रिसोर्स है भैया, पत्ते निकाल के उसकी ठेनियां फेंकते हैं,
सही बात है,
उसके फेंकते हैं। अगर वो सब इस्तेमाल हो जाए ना तो कोई बीमार नहीं रहेगा इंडिया में।
सही बात। यहाँ तो आधी मेथी की गुच्छी का आधी गड्डी काट के फेंक देते हैं, यहाँ तो बथुआ, पालक,
वो एक पत्ता निकालते हैं, फिर उसी को ही इस्तेमाल करते हैं। हम लोग यहाँ पे इतना सा भी मदन जी
यही तो चीज है। जैसे राजस्थान वालों को जल की महत्ता मालूम है, और यहाँ गंगा जी है, यहाँ कोई दिक्कत ही नहीं, पानी जल है, तो होता है। जहाँ कमी है वहां तो तभी
करी पत्ता करी से निकाल के बाहर रखते हैं खाने के लिए। हम लोग एक करी पत्ता मिल गया तो it was 2 years that I have not been to India.
Great.
So after 2 years, the moment I was there for 2 weeks, I have brought chiku, I have brought amrud, chiku, amla. वही
मेरे बच्चे बाहर है तो एक पीस खाते हैं एक दिन में।
Excuse me, it is a bit late, but we have been joined by Dr. Parswani, who has worked as faculty member in Karolbagh Tibet College. If you have
welcome Dr. Pani. Definitely, we would like to have blessing on the platform.
Yes, I think Madan ji's internet is unstable because of hurricane in London. So Madan ji is off and on. Madan ji is gone. He will come back. क्योंकि वहाँ पे storm तो storm का internet fluctuation हो रहा है. This is the first time in the history of UK and Germany that we had electricity cut. इंडिया से वापस आई तो बिजली यहाँ पे गई. मैंने कहा क्या हुआ, यहाँ पे बिजली नहीं जाती है ना? तो मेरे नेबर्स ने कहा नो टुडे वी डोंट हैव इलेक्ट्रिसिटी बिकॉज ऑफ हरिकेन. ऐसे इंडिया में तो भुगत के आई हूँ 2 हफ्ते. We don't see him, Dr. Pawan.
I'm here.
Yeah, you just said somebody joined. So bread, India doesn't understand.
Yunus, Dr. Paraswani, whether we would like to call Dr. Paraswani.
Indians don't understand the concept of bread. They think bread बीमारों को ही खिलाया जाता है. You know, bread. So, you know, bread is for diabetic, anti-diabetic things, na? बस उनको metformin डाल दो, 2 ग्राम और लगाओ, चलाओ. 2 grams metformin. What does it happen at the age of 35? They start metformin 2 grams. 2 weeks I was in India. I went mad. Everybody metformin. Hormonal changes, metformin. Weight loss, metformin. I have survived. I have one of the rarest disease, and in Germany I have survived gene therapy. I don't take. अभी यहाँ पे चल रहा था. From morning I did an integrative medicine conference on breast cancer. Idris was also one of the fellowship holders. So we have no free business. 25 euros you pay, you come, because free की हर चीज ना. I have seen प्याज छिलते हैं 4 लेयर चला जाता है, लहसुन छिला जाता है, हम लोग यहाँ पे प्याज के छिलके लहसुन के छिलते रखते हैं, उसको पाउडर करके हेयर वॉश करते हैं, इसलिए बाल अभी भी काले हैं।
यहाँ आधा प्याज काट के छिलके फेंक दिया जाता है, सही।
I'm saying that 2 years I was not in India. This time, early morning, I'm standing on my terrace. Every house had 2 buckets of कच्चा waste. इतना खाना फेंक रहे थे, 2 बकेट ऐसे पकड़ के खड़े हुए थे। मेरा दिमाग घूम गया। Then at least in my house, my sister-in-law and my mother, they don't waste. खाना नहीं है, बच्चे खा नहीं रहे। So
nice presentation.
Anyway, Madan ji, where are you? Thank you.
Thank you.
And Dr. Pawan, I put my email ID in your chat, so you would have got in your chat history. So you can just go in. Every month we host, I'm hosting a conference from Germany under European Medical Association and Integrative Medicine. But unfortunately, it's charged because I have to pay tax in Germany. That's welcome to the world of Germany. That's why we have to pay tax, we have to pay broadcasting fees, and Zoom per month is 600 euros.
Don't worry. We are non-commercial and we are conducting 20 webinars every month. And
you can conduct, because in Germany, if we conduct a webinar, we have to take the permission from the town as well, from my town where I am. So because the name comes in the hosting, so each participant, I have to pay 5 euros to take the permission to allow the participant.
Great, sir.
So now
Our
suddenly they said jihad, I said nahi bhaiya. So we have to be very careful with the words. We have to be very careful with the information they share, the presentation, the references. So we have to check everything before the presentation, submit it to the town. So pure saal ka, every month we have one, the whole years we have submitted, and we have paid a tax of 9,000 euros for this.
Wow, great.
So Germany.
Now I would like to request Dr. Paras Bani. Dr. Paras Bani ji, welcome.
Good evening, sir. Thank you. There was some network glitch. That is why I could not respond when you were calling. It was hanged. My mobile was somehow hanged. And then I didn't want to intervene in between while ma'am was talking. Sir, it was a great initiative by you that Unani Day was celebrated on this platform also. And with these eminent speakers, it was a great, and when it is available on YouTube, so it can be accessed by anyone, anytime, and a time will come definitely when it will help for the globalization of Unani. Everybody will come to know, and due to some busy work, I'm not able, otherwise I would have given my name, but maybe I will try with name with topics. That is more convenient, as ma'am told, because the topics we are already prepared for, that is easy to deliver. Those lectures we can easily give, but if we are given some specific topics, then it takes time to prepare and to research and all. And definitely I'll be associated with this great platform, and I congratulate you and whole team for regularly organizing these webinars. It takes a lot of courage. Thank you so much, sir.
Thank you very much. Today's session. Now, in the last, I would like to request Mohsin Saib or Younis Saib. Younis Saib, you have rejoined. Welcome.
Yeah, I got some problem with the net, so I changed the net.
Last comment. Yes. Last comment from your side.
I think Mohsin Saib is the better choice.
Yes, Mohsin Saib.
His internet has vanished. His internet is gone. Just copy internet. Whoever is having the internet can say thank you. Unfortunately.
Last but not least, Dr. Pawan ji, I wish that जो मैंने पहले भी कहा था, let us make minutes of these webinars, and then whatever is to be presented to the government, let that be presented to government through some organizations. We being the officials of the government, we are the government, so we can't present anything to ourselves. But from organizations like UDMA, ADMA, World Unani Foundation, Ayurveda Congress, Pawanji and Mohsinji are all in those organizations. You can present the memorandum to the government, and we can take government in the conference, ministry into the conference. Definitely they will listen to us, and they will come forward with some good things which will favor our Ayush system of medicine, as India is proving itself a leader in the system. and we are taking forward. We have person-to-person collaboration with Iran. We have collaboration with Bangladesh through World Unani Foundation. Then we have collaboration with Pakistan also, Sri Lanka also. We have the members in England, in USA, in UAE. So through these forms, we can go ahead. We can have the conferences as had been told by different speakers, that let there be international conferences in different countries. Let there be somebody approach the parliamentarians of United Kingdom. For that, Madan ji can help us, and other legendary people who are working there, they can help us. We have to take everything together. Together we are a force, and if we work individually, then we are nothing. That is it. 1 and 1 can make 11 also. And it has been said earlier by one of the scientists of CSIR, who was in the advisory group of CCRM. He told that if CCRM if CSIR will last for 15 years, CCRM will not last for 5 years, but together we can last for 20 years. And that is the fact. Together, Ayurveda, Unani, we can have some impact on the world community, and we can take forward our country's achievements. We can take forward our country, as our Honorable Prime Minister has been stressing for the long, that it is the Ayush which has the answer to every disease, all the diseases. And by that means we have to work together. We have to work together at the international level also. Everybody will come together, and definitely we will. आज नहीं तो कल हो ही जाएगा. Thank you very much.
That's why my humble request is there from all. Khalid Sahib is there. You are here. Paras Bariji is here. From Germany, Madam is here. Please. Don't forget to recommend Unani expert for next webinars all over the life of Pawan Sharma, because Ayush is incomplete without you. So please.
I am sorry. I am unable to give you the faculties, although I try my best. But being as I am having the busy schedule, I'm taking care of the administration, taking care of the even परसों बैंगलोर से आ गए, उससे पहले अलीगढ़ में थे. So I am on move. तो मैं faculty provide नहीं कर पा रहा हूँ, but I am trying my best. पिछली बार भी एक को request
मार्च
किया
का प्रोग्राम सर्कुलेट कर दिया है साहब सबको. वानी जी हैं, खालिद साहब हैं, सबके पास मार्च का प्रोग्राम पहुंच चुका है. मैं आशा करता हूं कि मार्च की हर वेबिनार में यूनानी मेरे साथ होगा और हम लोग सब साथ होंगे. जैसा आपने कहा कि मुट्ठी है तो ताकत है, पांचों उंगलियां जुड़ी हैं तो ताकत है. और फॉर्चुनेटली आयुष में भी 5 ही हैं, तो पांचों उंगलियां अपनी ताकत बन के उभरेंगी. दिस इज माय कॉन्फिडेंस. आई वुड लाइक टू कम्युनिकेट माय सिंसियर थैंक्स एंड अगेन थैंक्स. गुड नाइट, शब्बा खैर.
आयुष जिंदाबाद.
आयुष जिंदाबाद.